Eloise, the show is yours.
Hi, everybody. It's great to see you. So many faces and names that I've known for a really long time, including before ACUS, and so many people I've enjoyed working with on ACUS over the years, and also lots of names I don't know. So I'm excited to work with you on this project. It's great to see you, and thanks for sharing your time and energy on it. So I have some official things that I need to read to you now. So I will read them officially to you now, and then I will introduce the consultants. So here's what I need to read to you. Please note that only ACUS members, including government members and their designated alternates, public members, senior fellows, liaison representatives, and special counsels, whether or not on the committee, and their designated alternates, have full speaking privileges, meaning a non-ACUS member should write in the chat if you would like to speak. To avoid background noise, I'd ask that you keep your microphone on mute and either use Zoom's hand raise feature or add a comment in the chat feature if you'd like to speak, but only to indicate that you'd like to speak, not the substantive comment. I'll then call on you and you can unmute yourself. Please then remute yourself when you're done. I'd also ask that ACUS members and their designated alternates use the webcam where possible. With respect to attendees other than ACUS members and alternates, participation requires the unanimous consent of the committee members. Time permitting, I'll consider calling on such attendees at appropriate points and will presume that committee members consent absent their raising an objection. If any such participant would like to speak, again, please so indicate in the chat feature or by using Zoom's hand raise feature and wait to speak until I call on you. You can then unmute and please remute yourself when you're done speaking. And again, just to reiterate that for all participants, please use the chat function only to indicate that you'd like to speak, or for committee members and their alternates to vote when asked. Please don't hold sidebar conversations or put substantive comments in the chat feature. So that is the formal material I have been asked to read to you. So I'm looking forward to working through all of that with you. And with that, I will turn things over to our wonderful consultants. So let me introduce Pamela Hurd, Don Moynihan, and Amy Widman. Pam and Don are my colleagues across the way at Georgetown. And Amy is on the law faculty at Rutgers, and we're thrilled that they've done this work for ACUS. And I'll turn it over to, I think, Don, you're going to walk us through some slides, and then we'll open the conversation. So Don, go ahead.
Great, thank you so much. I'm going to start and then Don is going to take over and then I'm going to end. We are speaking on behalf of ourselves as well as Amy Widman for the purposes of the work that we did around identifying and reducing burden and administrative processes for ACUS. Let me just sort of start by saying, here's an outline of, thanks. Here's an outline of what we're briefly going to cover in terms of an overview of the report, which are tightly linked to the recommendations basically we ultimately made, or the recommendations that are on the table. Before I talk about the outline, I do sort of briefly want to say that in terms of our process, this report was definitely heavily driven by a series of interviews we did across multiple federal agencies, both across different entities too within federal agencies, just to be clear about that. So talking with consumer experience teams, talking with legal services within those agencies. So talking to kind of a wide range of actors kind of across and frequently within agencies. And that kind of roots a lot of our thinking around this report. So I'm first going to talk briefly about what we mean by administrative burden. And then next, we're going to cover the executive orders, and then we'll conclude by kind of walking through the agency practices employed to reduce burdens. So, sorry. So administrative burdens are kind of these onerous experiences we have when we interact with government, typically for people trying to access government benefit and services. And that's broad brush, right? It might be in social welfare programs, which we do heavily focus on in this report, but it also includes places like Department of Homeland Security and trying to get your passport or trying to go through immigration services, for example. And we break these down into kind of a way to think about it in terms of 3 kinds of costs. So there are learning, compliance, and psychological costs. And the learning costs are kind of the entry costs, like how do you figure out, in the case of social welfare benefits, what you might be eligible for to get assistance, for example, if you don't have enough to eat, or you need access to health insurance. So kind of what's out there. It can also include, though, the cost of like just understanding how to navigate those processes to gain entries to those programs, as well as to stay on those programs. It's compliance costs. Compliance costs are the things I think we typically think about, which are like, for example, the amount of time you spend on these processes, the amount of money you might have to spend on these processes if you need to hire a lawyer, for example, to get you through a process. And the amount of just energy and effort, paperwork, documentation, things like that. And then the last category are psychological costs, which are stress, frustration, anxiety, the kind of feelings we sometimes have trying to navigate these processes. And these can be minor frustrations, if I'm frustrated about the process of getting my passport, to the kind of stress and anxiety that can be life-altering. For example, if you can't access needed health insurance for a child, for example, because you can't cut through the red tape, even though you're eligible for the benefit. The kind of worldview behind this, and I do think this is reflected in the executive orders, which Donna's going to talk about next, is that people have an expectation when they interact with government, or we, and the normative assumptions behind this is that there's an expectation that that experience with government be simple, accessible, and respectful. And so just to be clear here, there sort of are normative values that underlie this. And again, I think they are also actually reflected in the executive orders that Don is going to talk about right now.
Hi, I'm Don. So part of the reason why we're here together today is because there is what I think is an unprecedented moment of opportunity in this policy area. There certainly have been cases where there's been interest in government in how the customers of government experience government. There has certainly been attention to frictions, in particular in regulatory spaces where businesses interact with government. But I don't think I've seen in the last few decades, at least, as much political energy behind the idea that government should be doing more to make the experience government less onerous and less burdensome. We can see a couple of data points for that. We're highlighting the customer experience executive order here from December of 2021. There was also a first day executive order from the Biden administration on equity that tied the equity agenda of the administration to making public services more accessible. We've seen a series of documents from OMB and in particular from OIRA that has, I think, tried to institutionalize some of these processes. And we see that institutionalization popping up in different places. There is a memo from OMB, Circular A11, which provides budget guidance, also has language now about identifying and reducing burdens. Updated guidance on the Paperwork Reduction Act that OIRA has released has also put this agenda on the dashboard of agencies. And the quote there at the bottom of this slide comes from, I think it's an April OIRA report on this topic. So there is a great deal of interest and momentum around administrative burden. There is a starting set of efforts to institutionalize burden identification and burden reduction efforts in government at this point. So it's a very good time to check where we are. And I think we are now at the moment of implementation, where we're going to see different agencies take on this agenda and figure out, as they're doing it, what makes them successful or what sort of barriers they encounter. And so we're going to give a snapshot of some of the key factors that we think jumped out at us when we talk to people in the federal government. And some of these, I think, will be maybe fairly straightforward, but we wanted to think broadly about relevant factors here. There is maybe a temptation to focus on specific tools, which we'll talk about as well. But part of what we saw in talking to agencies is that in agencies where this was going well, we heard that leadership had made this a priority, that there was strong buy-in from senior agency leaders. Obviously, the push from the White House helps with this, but it has given momentum to agency leaders who are already maybe enthused about the prospect of using agency authority to reduce burdens. This results then hopefully in efforts to get people within and across agencies to work together on this project. And there's some specific guidance in the report about how that is happening. The second sort of big factor we identified was capacity at the agency level. And I think in part then you start to talk about more specific things like customer experience teams. It's no coincidence that VA, where this is the agency that's probably made more progress than any other in terms of reducing burdens, also has the largest customer experience team of about 360 odd people. Capacity also means engaging in collaboration and accessing resources from different parts of the organization and coordinating them towards a single effort. And in some cases, it means agencies working together when they're trying to serve clients that have to interact with both set of agencies. Another, what we identify here as a capacity challenge, but it popped up in a variety of different ways, is what does it mean to actually measure burdens in practice, and whether it's possible to standardize this in certain ways so that it becomes a tool that's helpful rather than some sort of pro forma requirement that agencies have to engage with, but don't necessarily feel a great deal of enthusiasm for.
In terms of other kind of big pictures, factors that fed into our recommendations, a key one is about simplification. And so a key way to reduce burden in the broadest sense of the word is basically simplifying processes as one mechanism. So we can do things like, reduce the length of forms as the lowest hanging fruit, but we can also think about ways to reduce the numbers of steps in a process that for people to go through before they access a government benefit or service. Or we can generically think about things like reducing the amount of documentation that people are required. So there's a lot of different ways that we can simplify processes to the most extreme form, which are things like kind of auto enrollment for programs that people are eligible for, that we have data on them that know that they are eligible for them, and for which we know that they'd actually want to be enrolled in those programs. So that's like the most extreme form of simplifying a process, but that's sort of the types of simplification that we're talking about. I think it's really important to understand that simplification of processes is not a one-off. So it's not something you do once, but that you have to keep doing over and over and over again with an existing program. So I'll just give you one example, which is the Social Security program. So when the program started in 1939, it started in 1935, but when it really rolled out in the late 30s and early 40s, there was no internet to access the benefit, right? But one of the things that's happened over time is as technologies have changed and expectations have changed, there's new ways that people connect to a program and can access programs. So this is like an ongoing process, basically. This second strategy is actually the provision of support. So like hands-on support to help people through complicated processes. And so I think we see this at the IRS, right? With the use of customer service lines, for example. People can call in and get help in trying to navigate the tax system. And there's a wide array of different entities that provide hands-on support. So you're not really actually changing processes that much, but you are giving people hands-on support to like get them through those processes. Narrowing down a little bit in terms of thinking about tools and effective tools to reduce burden, both that's already happening and more kind of embedded in some of our recommendations. Big picture, one of the things we wanted to point out was the logic of kind of human-centered design, which is that's effectively a technique to think about administrative processes from the user perspective. and then you can use those insights to adjust varying processes to better match the design of processes to the individuals actually trying to navigate those processes. And this is, I think, something that we're seeing increasingly across agencies, and I think the digital services in particular, in terms of their collaboration with different agencies, has been employing as like a mindset to help people think about how to design tools to make programs easier to access. Another big important part of the toolkit is improved data sharing. So to the extent to which you can automate processes for people to make things more accessible and easier to navigate, the extent to which agencies can data share with each other, and even within agencies, in different entities can share data with each other, is kind of a critical basis for reducing burden and further automating and simplifying processes, right? So the fact that the most sort of the kinds of collaborations across the IRS and the Social Security Administration, for example, really help effectively automate documentation of income for people trying to access Social Security benefits in a way that isn't actually visible to most people, but is very accessible. And then finally, the kind of rethinking of cost-benefit analyses. So this is another kind of narrow, but at the same time, big picture point, which is ensuring that agencies, when they're doing cost-benefit analyses, are thinking basically about the cost of these burdens when they add new programmatic requirements or add processes, for example, or alter processes. That part of that cost-benefit analysis of doing that includes these sort of additional burdens that people might encounter.
So these are sort of the motivations for the report. The idea is what we're hoping is with the guidance now that we'll receive from you, that we can sharpen these into a set of solid recommendations and guidance for agencies that make them more actionable and more useful on the ground. With that, we'll conclude. Thanks for your attention.
All right, thank you. That was a really wonderful walkthrough of the project. So I think most of our substantive conversation is going to happen in the context of working our way through the recommendations themselves. But before we turn to that, I want to just pause to see if anybody wants to ask a follow-up question or sort of a more general comment or thought before we turn to the substance of the recommendations. I will pause. That was the question. Great. Bridget.
Hi, good afternoon, everybody. It's such a pleasure. I just can't miss an opportunity to thank our consultants for their very fine work on this, and to express my admiration to ACUS for taking on a project that has perhaps a little bit more grounding in the public administration side of the fence. I think this is really good and constructive, and it's the absolute right time for this project. So just hearty thanks to our consultants for helping us to structure this conversation.
Thanks, Bridget.
Thank you.
Thanks, accepted. Thank you.
All right. Well, anyone else with a question or any overall macro? All right. There will be so much opportunity over the course of our time together to delve into the substance. And so let's do that now. I'll just flag, since I know at least some people are new to the ACUS process, that we're scheduled to go till 4 p.m. We will likely really go till 4 p.m. We'll take about a 5-minute break halfway through, stretch our legs, get a drink, and we'll come back. And we're just going to work through recommendation by recommendation, line by line, substance and wording. And that's kind of the process of our work together. So Ben, I will ask you now to share your screen, which has the red line of the draft recommendations that you circulated, along with the suggestions and comments that we received in advance. So thanks for putting that up on the screen. And Ben, I'm going to ask you to let the first 4 be shown, since they go together, the burden identification and reduction principles. Okay, great. That's perfect. Maybe some of this is the size of my screen, but assuming other people may have well, actually, I have no idea what your screens look like. But anyway, this is helpful for me, and I hope it's helpful for you too. So we are going to start with burden identification and reduction principle number 1. So let's do that now. Federal agencies should seek to identify and reduce administrative burdens the public faces when interacting with government programs. I see Bill Funk's hand. Bill, I recognize you.
Well, actually, I wanted to address the title of the recommendations.
Great, sure. So scroll even more.
And because administrative burdens is a term that's usually used with respect to burdens on regulated entities. And although I'm sure the preamble made clear that that's not the case here, I think just the title would be better if it was reducing burdens on administrative customers. The term customers is used in a number of places, both in the recommendation and I think in executive orders. So I think that would make it clearer from the start so that people just looking at the title of the recommendation would get a better sense of what was involved. So that's my recommendation in that regard.
So Ben, if you want to find some way of capturing what Bill just said, so that we can discuss it, that would be great. I'd love to hear some other thoughts on this. I will just flag that my recollection is that in a previous recommendation from this very committee, we debated at length the use of the word customers. So some people at the time were not comfortable calling people's interactions. There were other problems, of course, with saying citizen, but I'm just going to say that customers was some language that people have had questions about before. So the floor is open.
And so just to
but then
clarify,
it would be great if you could capture, Bill, were you just asking Bill to say it again one more time?
yeah, just and Bill, are you speaking to the title, the overall title, as opposed to the subtitles of different recommendations?
I changed the title to say identify and reducing burdens on administrative customers. On administrative customers. This is the title of the whole thing.
The whole thing. Okay. So Bernard.
So I would suggest rather than customers, beneficiaries, which I think might more accurately reflect what we're trying to capture. But I note that still leaves out circumstances where people are trying to start businesses and they've got regulations they have to deal with. So I think this the recommendation and the report also seems to be going to those sorts of situations where you've actually got regulated entities. So neither customers nor beneficiaries would cover that.
Okay. So that's another word option. So Ben, I'm not sure. So first of all, were you not able technically to put the comment up at the title of the overall project?
No, I can do that. I'm sorry. I thought he
Okay.
was saying, yeah, so I didn't know if it was that or.
Yeah,
so
I think it's up for the overall project.
Got it.
And so the idea is that now we're sort of, and I don't know that you need to identify the
Okay, got it.
individual contributors.
Got it.
This is Ben's first time redlining, everybody. So we're going to be a
Bear
big,
with me, folks.
big.
After hour one, I'll get more into it.
And gratitude, and we're going to have lots of kind of calm enthusiasm as he works through the detailed words here. So we don't need to indicate who commented. So we have customers, we have beneficiaries, and David, I see your hand and I recognize you.
First, I want to note that Bill's absolutely right. When I saw this title, I got very excited to finally report to reduce my burden. So I interpreted it exactly like he thought people would. So I think a change is necessary. Public is the word that comes to my mind.
Okay. So any other members want to comment here? Sam?
Yeah, let me just put in a very strong plug for public customers. I was general counsel at OMB when we issued the customer experience executive order, and I bitched and complained about that title to everybody around. We're the government, we're not a business, and I think it's pernicious for us to act like we're a business. Public makes a lot of sense.
So then that could be identifying and reducing burdens on the public in administrative processes. Yeah. Okay, John?
How about identifying and reducing administrative burdens on the public?
Okay, so Ben, let's capture that last one. John, could you say that one more time for Ben to
Reducing
write down?
administrative burdens on the public. So right now you have reducing burdens on the public. Yeah, there you go. Administrative burdens. You can delete the.
Okay.
Yeah.
And I'm pretty sure that we probably need to keep identifying.
Yeah, right.
Preliminary. Yeah. So identifying and reducing. Okay, Bill, back to you.
The problem with talking about the public generally is the public generally includes all the regulated people. And this is not about reducing burdens on the regulated entities. And the whole point is these are people that the government provides benefits to, services to. I'm not wedded to customers as a particular term, but I think the title has to get across the distinction between the kinds of what government does to help people as opposed to regulate them. And I would really suggest not trying to take our time to word this now, but take it back to the staff for the next iteration to think about this distinction and try to come up with what they think is the best way of dealing with it. But just talking about burdens on the public, I mean, that talks about burdens on Exxon as well as the Small Business Administration. So I mean, that's my. I just
Okay,
think take it back.
Thanks, Bill. And I that makes sense to me. We definitely are not going to spend the rest of our time debating this title, but I would like to hear from Sam, Bernard, and then I'd like to hear from the consultants who I'm sure have spent a lot of time thinking about exactly this distinction. Sam.
I'm going to be super quick about this, which is we don't have to spend a lot of time on this. I think it's very difficult in practice to distinguish between beneficiaries and regulated entities. Often benefits come with certain regulations that apply to them. I think public works pretty well, but yeah, there's probably other language we can use, and happy to kick it back to folks to think further.
Great, thanks. And Bernard.
I like public to perhaps address Bill's concerns. We might say burdens on members of the public, which might have more of a connotation that we're talking about individuals as opposed to large corporations.
Okay, great. So let's call this particular title conversation to a temporary close. But first, I do actually want to hear from the consultants on this before we then turn to the first of the four principles. So I don't know, Amy or Pam or Don, if one of you wants to comment.
So I would just give some context here. I think the term administrative burden is a recognized term of art in the setting where it specifies burdens upon the public. I realize there is another research literature on regulatory burden. So I think it is perhaps helpful to have something that includes the public or identifies the group that is being served here. It is not necessarily easy to draw distinctions between regulatory burdens and members of the public. In some cases, small businesses, are subject to the types of administrative burdens that we talked about. There are whole classes of individuals, like let's say you're subject to supervision by Child Protective Services, where your activities are very much regulated by the state. And so the regulation part itself, I don't think helps us out of the naming problem here. But I do think there is sort of a consistency in the use of the term in some of the executive orders, in the OIRA statements, and other language coming from OMB that we're, I think, trying to be consistent with.
Okay, that's helpful. So, okay, one more comment, Bill, and then we'll go to principle one.
Thank you, Elise. I wonder if you talked about reducing burdens to access to administrative processes. In other words, isn't it about access here? I mean, that's, at least as people think about this, we're talking about making it easier for people to go through the process, either especially when they initiate it. And I think it's only when they initiate it. So I think it's an access issue, or at least that's the concept. Again, I really think that everything in these recommendations that I saw has nothing about reducing regulatory burdens, that is, burdens on people's primary conduct, as opposed to what they can get from the government. So I'd like you to think about that when they go back and try to redraft.
Okay, thanks for that. So, and I see that that Ben has added the word access. So that'll be something that we think through when everybody gets our heads together after this. Okay, so with that, thinking about what is the subject that we're trying to address here, let's go to the first of the 4 burden identification and reduction principles. So I'll note that we have the same definitional questions, administrative burdens, and the public. And I'll also note that John Kamensky has already flagged for us that we will need to define these in the preamble. I assume the preamble, as it's being drafted, will also reflect the substance of today's conversation. So I think then this also already incorporates the conversation that we've had so far. So we're going to have to go back and think about this, especially as it fits in with the preamble. But before we move on from point 1, recommendation 1, let's open the floor to see if there are other comments or suggestions people want to make with draft recommendation 1. Okay, I don't see any, so let's move to the second one. So agencies' efforts to identify and reduce burdens should focus on, we have the alternate suggestion of should take into account, or should be taken into account as they are improving benefits and services, the experience and perspectives of agency employees working in the area. So somebody, is this Claire Green's suggestion? Or we have
right.
Bernard, yeah, Bernard. Okay.
Yes.
So
the
Bernard,
blue
let
is
me
Claire
call on
Green's.
you. Sorry, Conway, before I get to you, let me, if this
Sure.
is Bernard's suggestion, let me just ask him to explain what he is thinking here.
Sure. So I was concerned as it was initially drafted because it looked like the efforts to identify and reduce burdens would be looked at essentially solely from the perspective of individuals who interacted with government programs. And I think there are other perspectives that need to be taken into account, as well as the interests of those who interact with government programs. I think it helps to add, agency employees working in the area. So I would fully support that modification. But I'm not sure that even that takes into account everything that one might conceivably consider in deciding whether and how to identify and reduce burdens on individuals dealing with the agency.
And we always have a choice with recommendations like this, whether we're going to have a all-inclusive list or a suggestive list. So among the perspectives that agencies should use to take into account include, for example. Bridget, I see your hand up. Conway, I think I saw you starting to want to have your hand up as well, and I flagged you for a minute. Did you, Conway, were you trying to say something?
Sure. I was just confirming that the blue edits were Claire's, and I can kind of explain that, or as well as the comment.
Okay, great. So, but why don't I ask you to, yes, go ahead and explain them, and then Bridget, I'll call on you.
Okay, great. Yes. So I think for the line edit, the experience and perspectives of not only the customers and people, but also the frontline employees, I think there's a desire to reflect that experience as well, administrative burdens being shared between the state. But then the comment is the sensitivity around improving benefits can be conceived as reflecting like the monetary value of it. And so potentially saying something like improving access to benefits or improving the administration of benefits would help clarify.
Okay, great. Thank you for both of those. Bridget.
Hello. So I would suggest resisting the temptation to make two, an all-inclusive list of everyone whose perspectives we should consult. I took two to be trying to say, hey, there's a really important group here that we tend to not do a ton of consultation with, and that's the people themselves who are, the potential beneficiaries of these programs. But I like the idea of including in that perhaps an express call out about the frontline employees who are actually working closely with, potential beneficiaries, for example. So, because I do think that those, sort of what we might call street level bureaucrats or frontline employees are the ones who have, lots of insights about it that, maybe folks at designing the programs at headquarters just don't have and perhaps are not consulted with. So I don't wish this to be an exhaustive list of any and all stakeholders with whom we might consult, but I do think to keep the spirit of sort of saying, okay, there's at least two groups here who regularly probably don't get consulted in a way that they should, and that's the frontline employees and the potential beneficiaries themselves.
Okay, great, thank you.
This is Nina. I can't figure out how to raise my hand.
Okay, great. And do you see the chat? Because if you put stuff in the chat,
Yeah.
I have the chat
All
open and I'll be able to see you. Of course, I can call on you now as well, just having heard your voice. But for anybody who can't find the hand raise function, if you just can find the chat and stick it in the chat, I'm happy to find you and keep a queue. Go ahead, Nina.
So building on what Bridget said, and I know nobody wants a laundry list, but later on in the comments on number 14, there is a laundry list of ombuds, public advocates, and navigator programs. And I actually think that it is often in agencies that they think about frontline as the people who answer the phones, whereas the people who are actually working the problems that end up in the hands of the advocates, the ombuds, the public advocates, and the navigator programs are actually the ones that have the greatest knowledge about burden. And I would recommend that we put that same language here, agency employees and other, in the area, and individuals who interact with government programs, including ombuds, public advocates, and navigator programs.
Okay, so we do not usually have two recommendations that say exactly the same thing. So I guess I'm a little bit wondering, and maybe I'll call on the consultants in a minute, though I see David got his hand up for number 2. So maybe I'll call on David in a minute, but I'm just flagging that I'm going to, in a minute, call on the consultants to find out what you see as the difference in the work that the Principal 2 is doing from whatever the recommendation that Nina is referring to that I don't have in front of me on my screen right now, so that we can figure out whether we want them to be parallel or somehow at different levels of generality. So consultants, I'll call on you in a minute, but first, David, let me call on you.
Yeah, sorry, this is just a quick clarification. There's been a lot of focus on access to benefits and services, but people's administrative burden and things like tax compliance or other forms of compliance individually don't really fall into the category of benefits or services per se. And so I wonder whether that's the right language.
Great. I guess I'll also note before I ask the consultants to comment that recommendation 2 also seems to be doing sort of two different things. One, it's the burden reduction should focus on improving access to benefits and service. And then as agencies do that, they should consult X kind of people. So I'm also wondering whether we want to separate these things out. So it's a bunch of things to respond to in number 2. And so any of the consultants, if you want to chime in with some views, that would be helpful. Pam.
Yeah, I mean, I think stepping back, to just build on, I think on Bridget's point, I think the goal of the executive order and then how we were thinking about it was there hasn't been enough attention, right, on the public's actual experiences in these processes. And we really think agencies should shift more of their perspective towards that. I think thinking about Bridget's comment, like, in service of that, paying attention, for example, to what frontline bureaucrats have to say, and other employees within the agencies, that is actually critical, right? Because they do have intricate knowledge of like the rules and these programs and all that sort of stuff in ways that can facilitate that broader goal. But that's what I wouldn't want to get kind of watered down, which is like a central point here is precisely that this group, the public writ large, we really do need to shift more of our attention to ensuring that we're thinking about them when we're designing.
Okay, so I think I hear you saying that as a principle, taking into account the people who are trying to access the government portal is what the principle is. The recommendation down the line is more specifically, as we're seeking to identify and reduce, who are the sets of people that we need to be talking to overall. Okay, I mean, so to me, that makes sense as doing two slightly different things. I don't know if the people who were, Bernard, I guess it was you who raised the idea of agency employees. I think it was you who raised the idea of agency employees. Does that satisfy you to be distinguishing between the overall principle of just making sure we talk to the affected individuals versus down the line in recommendation 14? And Ben, maybe you can flip us to 14 so that we can see it on the screen. I don't know if that satisfies the concern that you raised, Bernard.
So I don't think it was my initial point.
Oh, maybe did I make that up?
Frontline people, but I would like to keep two relatively short. I would actually be fine with, as long as taking into account as in, just
Yeah.
leaving it at
Right, that was yours.
the
Okay.
the public. I'm also fine with adding, frontline employees. I would get uncomfortable adding much more than that because it just seems to be too much for them.
Okay, okay. I actually don't see frontline employees in number 14. So Pam, do you, so it has to go somewhere. And thinking about, or maybe that's too much judgment. Does it have to go somewhere? And I know we just talked about an expanded set of ideas of who constitute, Nina was suggesting it's not just like people answering the phone. So what about adding that, putting a placeholder for it down in 14 and keeping up in the overall principle, just talking about the affected individuals? Is that something that you think would fall within the spirit of?
Can I just kind of chime in here?
Oh,
I think
sure. Hi.
the principal part really went to this human-centered design, which was underlying like a lot of what we were talking about.
Yeah.
I think at one point, I don't think it's still in there, but in the report, we used to have a section, put people first. I mean, that was kind of the spirit of the principle in the top. And then as far as 14 goes, that was really more about thinking about expanding representation and assistance in a very, very focused sort of way, which to my mind is a little bit different than the principle of starting with the people.
Right. So, and now that I see 14 on the screen in front of us, it absolutely is. So we may need some other recommendation, whether it goes in the principle or whether it goes in somewhere else, and whether it goes in the identifying or reducing, I'm not actually really sure, but I see a bunch of hands. So I also see Ben flipping back and forth now. So I want to make sure that we're respectful of Ben's efforts to capture all the comments. So Ben, how are you doing? Shall we pause for a sec while you capture?
Yeah,
this?
I can make a note as to frontline employees possibly
Yeah.
in 14.
Yeah, although I think probably it doesn't go in 14, but if you put frontline employees right there, then we'll remember to capture it for later. And then if you could take us back up to number 2, that would be great. Matt.
Yeah, you're going to find frontline employees in number 5, where we identified sources of information about.
Great. Okay, great. Thank you for that. So Ben, why don't you put like a little comment and just say frontline employees here, and we'll revisit that when we get there. Don.
I think that satisfies my concerns. I think it's absolutely the case that public officials, street level bureaucrats can themselves be the subject of burdens. And you see a little bit of mention of that in the latest Awira report about, reducing red tape within organizations. And they are also a great source of information about how to reduce burdens on the public. And I think we have that latter point in 5. We don't necessarily have that former point. I'm not, strongly opposed to it, but I think the emphasis on services and benefits to the public is more of the central theme of the report.
Okay, thank you for that. Nina?
I'm just going to go back to my concern and give some context to it. As the National Taxpayer Advocate over my years of service, my offices received 4 million taxpayer cases. So my, employees worked those issues and identified and were charged with identifying the most serious problems of taxpayers with the IRS and making administrative and legislative recommendations to improve them. And there are other advocates throughout the government, which ACUS has done a report on. When you just say agency employees working in the area, I don't know what that area means. And so that's why I really emphasize, including ombuds and public advocates, at least. That's their mission, to identify those burdens.
And Nina, with that substantive addition, would you have any objection in keeping it in number 5 below as a placeholder when we get to it later, with the idea being that the principle that I think the report is trying to get at in number 2 is that we should have the people at the center. And then the question is, how do we get information about the people at the center? And I think your point is helpfully that it's these ombuds and the other people you mentioned who can help explain that. but it may be that the
I
more
think
specific
what my
we get, the
concern
longer
is,
the low.
and maybe if we're not using in number 2, just the word frontline employees, and we're not using that, we're saying agency employees working in the area. I don't know whether the employees of the Taxpayer Advocate Service or wait, let me just finish the sentence, or the Department of Education employees, whether they're who are in the ombudsman for DOE student loans are actually in that description, agency employees working in the area. What is the area?
So I think I was suggesting we take that out. I mean, that was, I think, Conway, you may even have raised your hand to suggest that. So I'll let you do it.
Yes, I mean, I think that I would agree that the focus on this is to include the people's perspective. And this is more specifically about how do we identify burdens. And so going to the second section, I think that it could belong in 5D. And in 5D, we could clarify frontline employees and caseworkers. I think that, another group is congressional caseworkers, also kind of get a front hand look at some of the problems that come up. And so I think in 5D, specifying the front line and the folks that Nina is talking about is great.
And we can spell that out in more specificity when we get there. So I think we may be reaching consensus on the idea that we are going to delete the language in blue that's currently in line 6 that was from a comment submitted.
Okay.
So, and then we have a little bit of grammar that we have to fix because I think this sentence doesn't make sense. But, and we have Bernard's comment about take into account. So, we need to, and what if, are we doing any work by should focus on improving benefits and services? What if we just say agencies' efforts to identify and reduce burdens should take into account the experiences and perspectives? Consultants, are we missing something important if we delete the focus on improving benefits and services in this particular as a principle?
I like how you just said it. Just should take into account.
Okay, so then we would delete focus on improving benefits and services. And then we've deleted also this red. So it would now read, agencies' efforts to identify and reduce burdens should take into account the experiences and perspectives of individuals who interact with government programs. Is that capturing, well, one, is that capturing what the consultants are trying to convey with this as a principle rather than a sort of set of recommendations? I think I see some nods from consultants. Okay, and then does any committee member have any objection to the way we've rephrased it? Or want to add anything or want to make any other comment on number 2 before we move on? Okay, I'm scrolling through and I don't see any frantic efforts to find a hand raise bar, nor do I see anything in the chat. So I think we're good with number 2 for now. So let's go to number 3. Because individuals often interact with multiple government agencies and programs during key life experiences, such as starting a business or experiencing a disaster, agency and program officials should collaborate to identify and reduce burdens that would predictably arise during those key experiences. And I know there's a comment on it, and it's a little hard with the way this particular word program is working to see which comment goes with it, but I'm pretty sure it is Bernard's second comment here. And I see Bernard has his hand raised. So let me call on you, Bernard.
Yes, so I made a comment here because it seemed to me that identifying these key life experiences seemed a little ad hoc, and that it might make sense to be more comprehensive or purposeful in focusing on the most important key life experiences that agencies would then work on. So that's kind of my comment or question about, whether we can make.
Let me ask the consultants, because I think there's something, I think this is a term of art in some way, and I'm not sure exactly how. So Pam?
Yeah, this comes out of OMB, basically, like they identified these X number of key life experiences, basically. And so that's what we're referencing. They're a sort of limited, it's like retirement. There's like 5 of them or something. So that's what the reference point is too. I don't think we're strongly wedded towards those particular experiences. But that is where that it comes from.
And so I think
if somebody's not, if you're not on mute, can you put yourself on mute? And Bernard, let me see if you have a follow-up question, and then Steph, I see you. Steph, you're from OMB, right? So I'll call on you in 1 minute. Hello. But Bernard, did you have a follow-up that you wanted to ask or comment?
Yeah, so that sure. I mean, that sounds like a great explanation. Maybe we should we'll probably just identify the source of the list of key life experiences, and that would help kind of make this a little more focused, it seems to me. And if it's OMB, then they might change it over time, and then so this will get updated based on kind of how OMB updates it.
Okay, great. Speaking of OMB, Steph, let me call on you.
Yeah, and I think this would do what Bernie is asking. I was just going to suggest to note, first of all, that this language does relate to our cross-agency priority goal on the President's management agenda about designing, building, and managing government service delivery for key life experiences. But I think that maybe we could tackle this through preamble language that identifies this OMB initiative and provides a little more context.
So thank you for that. And it may be then that we don't want the parenthetical with examples, but we want to actually cite to the source, something like as defined in OMB's.
Yeah, I would recommend that. And it's not to say that, you know, the examples initially identified should forever be the examples.
Right.
It'd be good to leave flexibility to do this in the future.
Okay. And would it make sense? What is the language that it would make sense to reference there from OMB? So you mentioned, for example, cross-agency priorities, and I see Don put a link in to the President's management agenda. I'm not exactly sure. What would you recommend so that we can keep it specific enough so that the term of art is defined, but also general enough to allow for updating, as you just said?
So the language that we use is key life experiences that cut across federal agencies. I don't love the cut there, but I think that something like that would be helpful.
But is there some document that is the core legal home for that? Like as
the President's management agenda is, but here we're talking about principles. I think the principles we should focus on key life experiences, and then the context in the preamble is, you know, agencies are already doing this as part of the President's management agenda, and they should continue to do this.
Okay. So what if we just leave it like this then, that we delete the parenthetical that identified only 2 of them, and we use this more general language that OMB itself uses about key life experiences that cut across federal agencies, with the idea being that in the preamble above, we probably will both have a footnote to something, but also have it in text above the line. Does that sound acceptable to people? I'm looking for hands or a request to be called on if you don't think it's acceptable. Okay. Thanks for the thumbs up. All right. So I think, and Ben, yes, thank you for flagging that we want to deal with that in the preamble. Okay, so let's go to 4. When undertaking efforts to identify and reduce burdens, agencies should ensure such efforts do not compromise the integrity of their programs, particularly, and here this was, I actually thought this was Bill Funk's comment, but I don't see that. Yes. Okay. Bill, can you get your hand up?
Yeah, I'm here.
Great. Yeah. Hi, Bill. Did you want to explain why you suggested this difference?
Well, first of all, there's two suggestions in 4. One is mine, and one is somebody else's.
Great. Well, I'll get to him next. So let's start with you.
Mine is in my state of Oregon, we've tried very hard to reduce burdens of access to get benefits. And as a result, we have had an onslaught of false claims at great loss to the government and great scandal. And so I think that whatever we need, and I'm all in favor of reducing burdens on access to people who are trying to get benefits, but there is another side which can not only cost the government money, but also result in backlash against the very programs that we're trying to get people access to. So I thought that that this was an important concept, that if we're, to the extent that we're trying to reduce burdens, but keep your eye on the fact that we need to prevent fraud and abuse. So that's the reason.
Great. And I think program integrity is itself a term of art that includes efforts to prevent waste, fraud, and abuse. So there's actually maybe a parallel there already. John, I know you had some different language, but it's sort of conceptually the same set of questions. So maybe let's go to you and then I'll open up the floor to see how people want to handle Principle 4 in general.
Thank you. I think that do not is too strong, because there are cases where you're going to have some fraud, but you may have an enormous benefit that occurs even if you acknowledge some fraud. I know that, like in Australia, they had a program where they knew that they would have maybe $10 million worth of fraud, but they would have $100 million in terms of reduced cost and benefits. So there's going to be a cost benefit ratio as opposed to do not, is what I'm trying to convey.
Great. Okay, so I think between these two comments, we are on the right track of figuring out how to reframe number 4. So I'm looking for more hands. I see David. So let me call on David. Bill, I see you non-electronically, and I'll call on you in a second, but let me get to David and then I'll get back to you, Bill. But other folks, if you want to comment on this, please get your hands up. David.
Yeah, I was going to say that some of the administrative burden is not just to prevent fraud, but it's to accomplish other goals that we think are virtuous, like protecting privacy or collecting information on populations that we use for other purposes and things like that. And so the weighing the costs and benefits, and this comes out in the report, should be more than just to prevent fraud and abuse.
So, Bill, let's go back to you, and then I am going to try out some new language.
First of all, I have no problem with weighing the costs and benefits versus the do not. That's fine with me. And because it says particularly the need, it doesn't exclude the other things that were mentioned. But I think because I looked through the recommendations, and nowhere in the recommendation does it make any identification or acceptance of the notion that sometimes improving access can lead to greater possibilities for fraud and abuse. I thought it needed to be called out at least once, and this was the place I thought to do it.
Okay, so what if we say something like, when undertaking efforts to identify and reduce burdens, agencies should, and then weigh the costs and benefits of, and then I'm not really sure what we want to be balancing. Or it's possible that costs and benefits should even come in the first clause. So efforts to identify and reduce burdens, or agencies should weigh the costs and benefits of identifying and reducing. I'm not really sure, but I want to be capturing this cost and benefit issue here. Pam.
Just as like sort of background for, I think where this is coming from is, frequently that mismatch between kind of cost and benefit of adding burden and fear of fraud is like a huge source actually for really high levels of burdens and programs. And historically, what's happened is, for example, SNAP is required, the food stamp program is required to report on fraud and abuse. They're not required to report on the fraction of beneficiaries who lose access to those benefits because of barriers in the program, like the fraction of people who are totally eligible for those benefits who aren't getting them. So we were trying to be a little careful in part because actually the default does tend to be a heavy fixation on fraud and abuse. But one way to navigate this, I think, and sometimes I think people lose sight of, the very things that reduce burden, reduce fraud. Actually, I think arguably more on average. So a big theme in the report, for example, is the use of administrative data and better sharing of administrative data. So like if you look at the Social Security program, the retirement portion, there's almost no fraud in that program relative to the magnitude of benefits that are distributed. And in parts because it has this like whole administrative processes, administrative machinery behind the scene that functions well. And that's like incredibly low burdensome for people. So I do think it's in this language of cost and benefits. And I just particularly at the front of the report wouldn't want the inference to be that the trade-off always is you decrease burden, you increase fraud, because I don't think that that's true.
When you use, I'm sorry, go ahead.
That's it. So I'm not exactly sure how to nuance the language, but I think that's sort of where I think we're coming from.
When you use the word integrity of their programs there, were you actually thinking of waste, fraud, and abuse as what you meant by program integrity? Yeah, okay, great. I see language in the chat. I'm going to call on Steph, and then Don, I'll ask you to talk through the language. Steph?
I was just going to suggest that instead of getting hung up in the costs and the benefits and the sort of negative framing here, that we flip the framing to be positive and say, when undertaking efforts to identify and reduce burden, agencies should consider how to strengthen program integrity. I prefer that term, program integrity, because I think, Eloise, you're right, that it does trigger this relationship to fraud, waste, and abuse as a term of art, whereas integrity of the programs is a little more nebulous. So I'll repeat the language for the committee. Consider how to strengthen program integrity.
Agencies should consider how to strengthen program integrity.
And maybe that goes too far, but just trying to offer a more positive framing that does, to Pam's point, recognize that there can be benefits.
Okay, thanks. Don, let me ask you to talk about, I'm also going to just go back to there is some value, I totally recognize that, in getting the language out on the screen, but I think as we're trying to talk it all through, it's hard to have multiple things in the comments and on the kind of the oral comments and the written comments. So if you can sort of put that you have a proposal to make in the chat, and then I will call on you and you can make the program, and then we'll get it written that way. I might even ask you to write it then, but if we could just sort of hold off on having lots of streaming things in the comments, that would be great. So we have Steph's comment. Don, let me ask you to talk us through the proposal you have. And then Bernard, I'll recognize you to talk through your language. So Don.
Yeah, so I think the spirit of the language I'm proposing is that there are cases where there will be trade-offs between values, and that agencies, in many cases, they have a legal obligation to consider those other values, including issues of privacy or program integrity. And I think the wording here might be weigh or consider costs. One thing we do want to avoid is a sort of reflexive denial of attention to burdens simply by invoking these other values rather than actually weighing the costs. So if you say, well, we can't do anything here in terms of data sharing because of privacy, without considering the potential benefits of data sharing to access, that's not what we're going for. It's more about how much increase in access are we willing to trade for more data sharing, or how much increase in access or take up are we willing to trade for 1% more in fraud. And so I think it's the idea of having this trade-off and actually trying to calculate the trade-off between different values is what we're trying to go for with language.
Sorry, what you're trying to avoid with the language, or what you're trying to promote with the language? I missed the verb there.
Go for with this language. Promote.
Go for. Okay. Okay. So that's that proposal of agencies should weigh the cost to other important values, such as. Bernard, did you want to offer your?
Yeah, I'll defer to Donald's.
Okay. Okay. Ben, I lost Steph's language on the screen. Where did it go? I don't see the comment there it is. Okay, thank you. So I'm wondering if there's a way to integrate Steph's affirmative with Don's, and I'm not immediately seeing it. When undertaking efforts to identify and reduce burdens, agencies. I welcome other hands here to either merge these or pick one. Agencies should weigh the cost to other important public values, such as program integrity, but that misses Steph's point that we sort of affirmative efforts to strengthen program integrity. Although maybe that doesn't belong here in this principle. Maybe that's a general point that doesn't belong in the principle. Steph?
Yeah, happy to go with Don's formulation.
Okay. Okay, so let's try that then. When undertaking efforts to identify and reduce burdens, and Ben, maybe can you get back in the document? Rather than the like sidebar, because I think now we're trying to see what it looks like. When undertaking efforts to identify and reduce burdens, agencies should weigh the cost and then delete and benefits of. Weigh the cost to other important public values. The such as is, I think, a complicated question. So we have such as program integrity. That doesn't then capture Pam's point that it's not a zero-sum game. And it doesn't include, people have mentioned privacy numerous times. There's a lot of discussion of privacy and other things in the report. We don't have preamble language. I don't quite know what we should do here as between specificity and generality. Maybe instead of such as, we should have including program integrity and leave it at that. Or is it important that we get privacy and something else here? Steph?
I'm fine with including, but if we wanted to try and have a more positive framing again, maybe we could say consider the impacts to other important public values, which doesn't assume cost.
Mm-hmm. So agencies should consider the impacts on other important public values, including program integrity. Bill?
I was going to say, if you just leave it as program integrity, I can accept that. If you start adding something like privacy, then I'm going to insist on preventing fraud and abuse. Because again, I think there's going to be a lot of people who look at these recommendations when you get before the administrative conference who are going to be concerned about making it too easy to get government benefits. And I understand the pushback from the consultants about how really it actually doesn't have to have any effect on fraud and abuse, but to at least acknowledge the problems. And I'm willing to accept this sort of generic program integrity as a stand-in for that, but that's all as far as I'll.
Right. And I guess just to clarify that, since I'm not 100% sure that the consultants, like the process that we're doing here is just to reach agreement as a committee, but it still has to go to the whole assembly where it could get voted down. So, right, like we're balancing. So I think what Bill is doing is suggesting ways to balance that. When undertaking efforts to identify and reduce burdens, agencies should consider the impacts on or weigh the cost to.
I like the language the way you have it in blue.
But we have two competing languages in blue now. Consider the impacts as different from weigh the cost to. I think consider the impacts on program integrity captures more what you're talking about, Bill. I know there were some votes in the chat. I don't want to use that word. There were some thumbs up in the chat a few minutes ago when Don was proposing the weigh the cost of language, but I feel like that was maybe to a different alternative. So what if we delete the weigh the cost to and have it be when undertaking efforts to identify and reduce burdens, agencies should consider the impacts on program integrity, full stop.
Other public values, including, I think that's.
Did you want that? Okay, I thought you were suggesting get rid of it.
No,
fine.
As long as you flag the program integrity.
Great. Should consider the impacts on other important public values, including program integrity. How do we feel about that? Are there any concerns or suggestions from anybody else with the language as we're reaching agreement? Okay, I see some thumbs up and some nods. Okay, right, like thumbs up of both the electronic and the and the visual variety. Thank you for that. It's hard to read the room, as you all know.
Thank you, Eloise. I have to go now, as I indicated earlier.
That's right.
Sorry, I can't hang on for longer.
Good luck with your house stuff, and thanks for contributing so far. Bye. Okay, so I think we are at when undertaking efforts to identify and reduce burdens, agencies should consider the impacts on other important public values, including program integrity. And I think I see no hands, so I think we might have reached consensus on this language. Okay, so I am going to move us now to the next set of draft recommendations, which are burden identification strategies. And Ben, before we get into 5, which is where we have this placeholder, can you just sort of really slowly, no, the other direction. I was going to ask you to really slowly scroll us through just so that we can have at the front of our minds. So we have 5, this thing where we're going to be adding people to talk to. We have 6 where we're going to be talking about journey mapping. We have 7 where we're going to be talking about what's Congress and what's agencies. And we have 8 by talking about costs, quantifying costs. Okay, so those are the 4 things that we're going to be working through now, just so that we can sort of see the scope of what we're doing when we're talking about burden identification strategies. And again, just to reiterate, these are just the identification strategies, not the reduction strategies, which will follow. Okay, so with that overview, oh, and bye, Bernard. Have a good class. Let's start with number 5. So this is the one we've already flagged a little bit about here. So agencies should institutionalize procedures for consulting with individuals who interact with government programs. And now we call out some certain kinds of people. We have John Kamensky proposing an addition, and then we have a separate set of who are the people who should be targeted. So those are the kinds of things that we need to get at here. So John, maybe I will call on you first since you have the first comment, and we'll take it from there.
I just wanted to flag that it's not just underserved communities and non-English speaking communities, that there are other communities, disabled being the one that came to mind. There may be other communities, but I don't know how to frame it so that we're inclusive as opposed to exclusive.
So Pam, I see a thumbs up. Is there a term of art that you are historically underserved and individuals for whom? Do you want to add disabled people, people living with disabilities? We want to get good disability.
I think he's right. Yeah, it's like, yeah, if we can. I mean, I 100% agree with that. It's like the group actually that tends to face the most burdens in public programs. So yeah, you can't like be, but it's like that list thing. You can't put everyone, like you can't put everything in there. But I think John's,
you would recommend that. Okay, great. Belmar, I'm sorry, Belmar. Warren, thank you for putting your name in the chat as somebody who wants to be recognized. And Warren, I'm going to call on you now. But I can't see you. So are you finding your microphone?
Okay, it helps if
there you are. Yep.
I just muted. Sorry about that. While we're trying to identify people who might need special help, we introduced the phrase by particularly. I don't like particularly. That seems to indicate something that I think we want including if we feel the need to specify who we're, trying to talk to. So I delete particularly and put in including. And then I have trouble with the general phrases. They appear so often in so many different places, but I'm not quite sure, geographically or otherwise, who we're actually considering to be historically underserved, and who in particular, that have problems with English language. If it's a national program, is it the people in Detroit that you have to talk to, or the people in New York, or is it general? Generally, I think the point that we're trying to make is that the agency should have procedures for consulting with individuals who interact with government programs, and period. But if we want to try to identify and in essence characterize people who need special help, then I just make it as including rather than particularly.
Okay, so I think I hear you saying that your preference is just to have a period, full stop, after government programs. But if we're going to call people out, then including rather than particularly with is the right thing.
I'm picking up at the end to better understand.
Yeah. Okay, thank you. Thank you for flagging that. Okay.
And if we do include the phraseology as expanded or contracted or whatnot, I think we need a little bit more clarification for the agencies to know who they're supposed to address and who is not underserved. And you start getting into all kinds of potential questions there. But again, I'd use including rather than particularly if the group wants to include that.
Great, thank you for that. Can I turn to the consultants to get some reactions to this and suggestions for how to accommodate or resolve?
I think we're good with the proposal on the table. I mean, I think it's one of those things, like, I actually think it is useful to label just so we're clear generically about what we mean. Do you know what I mean? Like, it's like in a survey, like, just make sure people understand what we're saying is sort of how I'd think of it. So you pick out some groups that we think are particularly subject to this stuff, like disabled people. So anyway, I think I'm okay with the proposal. I don't have.
No, but the proposal would be including historically underserved communities, comma, individuals for whom English is not their primary language, comma, and people with disabilities.
Could it be such as? Could we employ such as?
I think that would be better.
But wait, such as has a different meaning, doesn't it?
Correct. So you're not limiting. You're just
I don't think you mean such as.
Such as excludes people who
Yeah.
need the extra help.
Lots of people who don't fall into any of those three categories interact with government programs. So I don't think you mean such as.
That's why I used including.
I guess including to me sounds exclusive then, though.
All right, let me call on Sam.
Not sure.
Yeah, I mean, I think we could say including underserved communities such as, and then have something else. I know what that, such as individuals for whom English is not their primary language, individuals with disabilities, and I think we'd want a third that captures, something like race or socioeconomic status without actually calling that out specifically, which is why we use this phrase historically underserved.
Well, if that's what we mean, why aren't we using those phrases? Why are we hiding it if that?
Well, I think a couple of reasons. I think if we're calling out race and saying take affirmative steps to reach out to people of particular races, that may raise constitutional concerns, particularly in light of evolving Supreme Court jurisprudence. So I think
we should make it clear that we're not including that when we say underserved communities.
Well, I mean, I think the point is that we want people to do what is appropriate in light of what our goals are here. And we're not going to resolve any of those questions in this statement. And so we don't want to say anything that makes clear that we are including something that we shouldn't include, but we also don't want to foreclose things that might be allowable just because of our language. So, I think, including populations of a special need, or particularly with populations of a special need, including historically underserved communities, individuals with disabilities, or those for whom English is not their primary language. I think there are a variety of ways you can do this, but I like doing including, but it just has to be what is it including? What does the including apply to? It applies to the group that we are making a special efforts to reach out to figure out what the burdens are.
Well,
I also think staying historically underserved in that way then may address some of, Warren, your concerns, because you were talking about Detroit, but as an example, Detroit versus New York, but who may be historically underserved may be different with different programs at different times, and so may encompass quite a lot of things. So Sam, can I just get you to say that? Warren, I'll call on you in one sec. But Sam, can I just get you to say it one more time slowly so that Ben can write it down, your proposal?
Yeah, so let's see. Should institutionalize procedures for consulting with individuals who interact with government programs, particularly those.
I thought we were doing. Okay.
Well, hold on. What I was doing, I don't know what we were doing, and clearly Warren and I aren't doing the same thing because he's about to disagree with this. But what I was saying was particularly those who face special barriers, including historically underserved communities, individuals with disabilities, or individuals for whom English is not their primary language.
Okay, including. All right, we already have some of this language, Ben. So Warren, I promise I'll call on you in a second. Let's just get the proposed edit up first.
Yep.
So
yeah, could Sam just repeat the including historically underserved communities?
Sorry, I muted. Yeah, including historically underserved communities, individuals with disabilities, or individuals for whom English is not their primary language.
Okay, thank you, Sam. Warren.
Okay, you took out the other. I still have problems with the underserved communities definition, and it's so broad and so individually deciding what groups would fall under it, that I've got no problems with disabilities, no problems with English as not the primary language, but the third one of underserved communities, I'm lost on that, and I know it's a common phrase, but
Right.
no one
So I guess
bothers to put a definition to it, and when we try to put a definition, you said it could raise problems, and so all we're doing is talking about everyone should be contacted. What you start off by institutionalized procedures for consulting with individuals who interact with government programs, and now we're trying to distinguish who those individuals are instead of everyone. And again, underserved communities leaves me at a loss. The
Okay.
others not.
Okay, thanks for that perspective, Warren. So I invite more comments on this first sentence. So I see Steph.
I just wanted to share that underserved communities is a term of art that's been used in several recent executive orders, including Executive Order 14091 and 13985. So I wonder if we could help to resolve this problem by referencing those executive orders in the preamble and explaining there a little bit more what is meant by those terms.
Okay, thanks for that. Ben, if you want to just put preamble plus EO or something as a placeholder, that would be great. Pam?
Yeah, I think that's a nice idea. I just want to like background so we don't get lost in the details. I mean, I think the thinking here from our perspective is that if you look at the research basically behind who has trouble accessing these programs, it is disproportionately people with disabilities, people with low incomes. There are people with, English as a second language. Like we know empirically that there are certain groups of individuals who tend to struggle the most with these programs. And so that's where the sort of spirit of this comes from. I just wanted that out there so that in terms of, as we're like digging into the details of what that language should look like.
Okay, thanks, Pam. Elizabeth, I got a chat from you. Go ahead.
Yeah, sorry, my hand gesture's not working. I tend to agree with Warren. I think the underserved communities, even if it's a term of art, just is difficult to reconcile here. I mean, to me, the principal part of the sentence is that agencies should institutionalize procedures for consulting with individuals. That's everybody. And then if we're trying to focus on people who have particular communication barriers, whether it's a disability, for someone who is sight deprived or hearing deprived, or someone who doesn't speak English as their primary language, that makes some sense to have as an including, as a call out. I think beyond that, I don't know that it's really helpful, or to me, I guess I get more confused by adding to that bucket. I actually would be comfortable just stopping it with, individuals who interact with government programs, period. But I think if we're going to go for a call out, I would focus on, maybe people who need assistance in a channel that's particular in some way.
So just to make sure I understand, so there's sort of several different options here. One is put a hard stop after government programs, or delete the whole thing, the middle phrase, but keep as Warren said, to better understand the burdens in those programs. That's one option. The second option is to keep all three call out, which I hear you saying you don't want to do. Warren also has voiced some concern about that. And a third option is to keep individuals with disabilities and individuals for whom English is not their primary language, and to get rid of the historically underserved. Where are you among those options, Elizabeth?
I mean, honestly, if it were me, I would end it after with government programs, unless, there's further discussion on exactly what we're trying to have people prescribe. Yeah, okay, I mean, great. Unless, again, I'm not really sure what we're trying to do here. I think,
I hear that. And David.
Yeah, sorry, I don't want to belabor this point. I think that, and Pam and Don can weigh in here, but I think this the reason behind this is that the burdens of administrative processes fall more heavily on some groups than others. And so maybe the sentiment here is just to say, particularly those on whom the burdens fall unequally or something like that. And that can be lots. It can be the elderly. It can be people with particular kinds of disabilities. It can be people in particular, racial or other demographic groups, something like that. And maybe a broad category is better here than trying to, sort of keep the larger sense. But.
And David, is that different? The language that you suggested, is that different in intent from particularly those who face special barriers? Like, what if we just lost the whole including phrase? Would that be captured, those who face special barriers? Or were you trying to capture something specific with the unequal reference?
I think that face special barriers is good, but I think it sort of groups people into categories as opposed to recognizes gradations in the costs of bearing, right? Some people know some older people know how to use the internet, some don't, that kind of thing. And so I just thought maybe there's a better term than face special barriers, but special barriers is better than trying to identify what these different groups are.
Okay.
Does that make sense, Eloise? Sorry.
I think I get it. Matt, Gluth, let me call on you.
The Committee on Style just suggested some a basic reframing to kind of instead of using terms of art or identifying particular groups that have historically faced disproportionate burdens, just identifying generally disproportionate burdens that those agencies are aware of, that people who access them have historically faced.
Okay, that is a helpful comment from the Committee on Style. Thank you for that. Aaron, I'll recognize you.
Thanks, everybody. I think I agree with the folks who are concerned about the language. I'm just confused because I think a lot of people would say that those with disabilities or those for whom English is not their primary language are historically underserved. So it looks like we're making a distinction between them, when I don't think that's the intent of the sentence. And I think if we try to keep that historically underserved language, we're going to have category errors with the rest of the parts of that sentence. So I'm inclined, to agree to maybe cut it off as special barriers or something like that, because otherwise I think we're just going to have overlap.
Okay, thanks for that, Aaron. Does anybody else want to weigh in as we're figuring out whether to call out examples, go with the Committee on Style, generalizations, stick with special barriers only?
Well, Warren, again, last time, we're talking about individuals who are trying to access a program, not groups who are trying to access a program, not groups who have been historically facing disproportionate barriers. We're talking about people today who want to apply for Social Security or whatever the program might be. And what we're trying to do is identify what barriers exist and how to help people. And the agency seems to be doing that with different language opportunities, different opportunities for people to call in and get help if they need it. So again, if we're looking at the individual, it's kind of hard to cast a net for groups because groups aren't the same. And so I guess I'm coming back to suggesting that we keep it as limited as possible by deleting that whole phrase.
Okay, thanks.
Say special barriers. What's a special barrier? I just don't know the definitions of marginalized communities or special barriers unless we are going to try to define them somewhere. Or they are.
Right, and I think there was this idea that there's a definition in the executive order. I see your question in the chat, so I think that's why we had put that placeholder that Steph had said that it's defined, so we could do that in the preamble. But I hear your concern. I totally take it, and I want to hear from people we haven't heard from on this particular question. So first, let me recognize Nina.
So I think I'm thoroughly confused as to what, we've got some language in the chat from Matthew, and I like that language, replacing, saying particularly those who have historically faced disproportionate barriers in accessing those agencies' programs, and using that instead of the list. But then that means, well, what about the people today who are facing disproportionate barriers? So I don't know whether I'd say historically faced, particularly those facing disproportionate barriers in accessing those agencies' programs. But I think that really talks about, it just focuses what we're trying to address. That's my vote.
Okay, thanks, Nina. So it's a vote for the language in the chat, but to change the historically to currently facing. Okay, thanks for that.
Or just maybe have faced or are facing,
Okay.
just.
But to bring it into the present in some way. Okay. Thank you for that. Sam? I lost you, so did you? Okay, there you are.
Here. Yeah. So one is, I think that a general phrasing is probably going to work better than listing anything here for a variety of reasons. Two, I think that a lot of the comments here are kind of losing track of what the point of this particular provision is. So this particular provision is not so much saying, let's eliminate barriers for these people. That's the overall purpose of the set of recommendations. This particular provision is about the affirmative outreach and consultation and information gathering that the agency will do in order to identify what barriers are likely to exist. And I think there is a value in doing that, in saying, agency, when you're trying to figure out what barriers are likely to exist, you ought to think about who are the kinds of people. I'm trying not to use the word groups, but agencies deal with large masses of people, many of whom have common patterns of interaction with the agency. Call it whatever the hell you want. And what are the kinds of people who are likely to experience barriers, have experienced barriers with your agency or other similar agencies in the past? Do outreach to them to try to figure out what are the barriers that they face, particularly in dealing with your programs, and then use the rest of these recommendations to respond. So I think having some language in there that talks about people who face disproportionate barriers, and it could be historically and now. I think we could do the language a lot of ways, and we could call it disproportionate or special or whatever. I think the concept of some people in some common patterns are likely to experience certain kinds of barriers that it's really important for agencies to identify, I think needs to be in there. And so I think general language like Matthew's, tweaked appropriately would work fine. I mean,
Okay.
would work fine.
Thanks for that, Sam. Before I call on you, Elizabeth, I just want to try to combine this language, and so to see if we can be reaching agreement on something. But keep your hand up so I don't forget. So let's have Ben, if you could be working on this. Let's keep special rather than disproportionate, actually, particularly those who face special barriers, and then after barriers put in accessing agency programs, or in accessing that each agent, we have to figure out, we have to map the plural and singular, but in accessing the agency's programs, delete the including in the list. But then keep the to better understand the burdens in those programs. So it would read, agencies should institutionalize procedures for consulting with individuals who interact with government programs, particularly those who face special barriers in accessing agency programs, to better understand the burdens in those programs. It's a little repetitive, but I think it's trying to capture both some of the concerns we've heard and also some of the goals that we've been hearing about the outreach. So this may be, I'm hopeful, maybe a place where we can reach some consensus as a committee. and let's put a question mark at the end of that statement, and I'll turn to Elizabeth.
I was just going to say, I think I could probably live with some version of Matt's, committee language. I do think, and I agree with Sam. I mean, to me, when I read the thing in context, the whole point of this is to say agencies should institutionalize procedures for consulting with individuals, and then we list all of the things they should do: client surveys, targeted outreach, da 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 da. Because the whole point is not to presume and prescribe what happened or to try to define it for them, but to say, look, you've got to be mindful in how you are interacting with individuals. Use these techniques and identify whether there are people who you should be serving or should have access to your programs, and you're not getting to them or they're having trouble. So, if it kind of gets to consensus, I could live with some version of what you have on the screen. I guess in terms of referencing some sort of special barriers, I wouldn't go beyond that. I think the whole point of the process that we're suggesting here is to have agencies identify it today, and not to get into some, discussion of who was historic or disproportionate or this and that. I think that's very difficult.
Okay, great. So I think I hear some consensus then emerging around the language that we have on the screen. I wonder if anybody else would like to propose any additional comments on this sentence as we've been working on it. I'm going to pause for just a minute to see if any hands go up or anybody says in the chat they want to be heard. Okay, Steph.
I just have a scoping question that's sort of overarching to the recommendation, but is this any government program, or are we particularly talking about accessing agency benefits or?
Well, consultants, I mean, I think some of this is going to be worked out as we specify what we mean in light of our comments on the title and as we figure out the preamble. So I don't think we should be defining at every step along the way what we mean by programs. So I hope we will have taken care of this earlier. But do the consultants want to respond to that in any more substantive way? I don't think we just mean benefits. That's just me though. Consultants? Who's still on the line? I think we have both Pam and Don still on the line.
Yeah, I think we want to keep programs and services with the idea that some of these are beneficiary programs, but some are, as Dave mentioned earlier, routine services like paying your taxes that people would encounter.
So are you then suggesting that where we have the word programs, we need to have the word programs and services? Or are you suggesting that we will be taking care of this by defining what we mean by the scope of programs up in the preamble?
Probably safer to say programs and services for now, because I wonder if we'll end up getting into trouble defining programs in an incredibly broad fashion that people will disagree with.
Okay, one slight concern I have with that is that we already say the word programs 3 times in this sentence, and I don't think that we can face, at least I personally, former 7th grade grammar teacher, cannot face having a sentence that says programs and services 3 times. I'm barely tolerating programs 3 times. So I hear you, but I think counter to my instincts, since I just asked to include you for your views, I wonder if, can we put a pin there? Also more consultant language that I hate. Can we put a Matt, I don't know what COS means.
The committee on style.
Committee on style.
Refer that
yes.
to the committee on style to remove.
Thank you. I would like to move that we refer that to the committee on style. Okay, thank you. That seems like a great way to handle that. All right, with that, I would also like to propose we take a 5-minute break. So let's take a 5-minute break. We'll come back at 2:50 and we'll work our way through the other half of this this proposal. I'll see you all soon. Hi, everybody. I am back. I don't know if the rest of us are.
Can I make a suggestion before we get started? Just to
Sure, although if it's a suggestion that other people are going to need to weigh in on, then maybe we should wait until we do get started, or is it just for me?
well, just for you.
Oh,
it's
okay,
your
sure.
question, I like it, but we're talking about the let me get out of this. Okay, now reads, agencies should institutionalize procedures for consulting with individuals who interact with government programs, particularly those who face special barriers in accessing, instead of agency programs, can we say those?
Sure, I think that makes sense. The note we
And-
currently have is that the committee on style rather than the full committee that we are on substance. We'll work that out, but that makes
Okay.
sense, and we can handle that.
And then the next part, to better understand the burdens they are facing.
Great.
Rather than,
Great. That's we'll
that's my
tuck that-
committee on style contribution.
Yeah, no, but that's great. That's super helpful. Thank you for doing the committee on styles work. We'll tuck that away in that the burdens they are facing. So Ben, are you here yet? Somewhere? Or maybe Matt, can you
So
capture?
yeah, I'm here. Yeah, I got that.
Okay, yeah, hi Ben, great. So just, you want to capture that?
Yep. Oh yeah, do you want me to capture? I was capturing in like separate notes, but do you want
That's
me to put
totally
it in the
fine, because we'll
document?
deal
Okay.
with it in the committee on style.
Yep,
That's
okay.
totally fine. Okay. All right, so if folks are back, and I'm just scrolling through to see if, I mean, there's a ton of screens off. I don't totally know what that means, but it is 2:52, and I think we're going to get started. So I hope folks will rejoin us. And thanks to those of you who just turned your screens back on. Hello and welcome back. Okay, so let's return substantively to the last sentence of recommendation 5. So here we also have some placeholders from before, but agencies should employ multiple consultation techniques, including, and then we have a bunch of things: client surveys, targeted outreach to communities, requests for public comment, complaint portals on agency websites, consultation with agency staff who work with the public, consultation with members of the private sector who assist individuals such as representatives, navigators, and social workers. And we had a comment, I think, from John Kamensky. Oh no, that was an older comment. We have a comment, I guess, from Bernard Bell, but I think he had to drop off, about defining the word navigators. And then scroll down, I can't see actually, Ben, is this, no, this is not, John is not commenting on this. Okay, so we had that from Bernard about defining navigators. And before Nina, who just had to drop off, left, she had given us a bunch of placeholders for, this is where we were going to talk about ombuds and other staff members here. I don't actually see that language written down anywhere. Do we have that in placeholder? And she had to drop off. Maybe we don't have that. Maybe we do. Ombuds, I don't know. In any event, I would love to welcome, there we go. Thank you, Ben. I knew we had that list somewhere. So maybe let's get that language in here. Consultation with agency staff who work with the public, comma, including frontline employees, caseworkers. Although I know somebody else had said legislative caseworkers. So that might need to be its own thing.
You're going to start putting it in the body of the text, or just...
Well, maybe for now don't, because I would like to gather some more comments before we start wordsmithing. So let's see where we are. I know, but I did want to separate out, because we already had this comment. Agency caseworkers is different from legislative caseworkers. And so we might need a separate thing on legislative caseworkers. And then we have to define navigators. So maybe I'll ask consultants, Pam or Don, do you want to, how do you want to handle the request to define navigators?
Yeah, I mean, I'd honestly have to, it's been kind of common parlance in some domains. I mean, I honestly can't, like, right off the tip of my tongue sort of give you a precise definition. We just used it because it has been used in a lot of programs, for example, around Obamacare, the healthcare navigators. And I remember Amy talking about it in the context of, I thought, legal services. But I don't want to speak for Amy, and she's not on, but it was really more meant to give a sense of the different, there are these sort of external supports, and here's some examples. It was meant in that spirit.
So, but even if I wonder if even putting the word program navigators before navigators, right? Navigators conjures up like undifferentiated high seas to me.
Absolutely. Anyway. Yeah, that's fine. That's fine.
Okay. All right. So, and then we have the list from John. Let me call on you. Looks like you want to offer a substantive point.
Is case managers a more common term that would be as opposed to program
I think it has a different meaning, though. I think case managers talks about helping you with your particular case, whereas a program navigator may just like walk you through how to handle a program rather than actually handle your case. But it does suggest that case manager might be a person on the list. Are case managers typically members of the private sector who assist individuals, or those within the agencies themselves, though?
It can
They
be.
tend to be. Sorry.
John, what were you going to say?
I'm sorry. It can be both. It can be both private sector as well as government or nonprofit. Yeah.
Okay. So, any other comments? We have to figure out how to integrate this list, but as we're doing that, are there any other comments, either in expanding the members of the list or normative concerns about any of it, or just like substantive comments in general on this part of recommendation 5? I see David, go ahead.
No, I was just going to make the point that I think we all recognize, which is it doesn't have to be an exhaustive list. And just because you include some doesn't mean you're excluding others. And so I think we could wordsmith this a bit with Committee on Style and just give some examples.
That seems fine to me. So I guess I just want to be capturing now, making sure that we capture now the substantive wisdom of the committee so that the Committee on Style can actually take this on. So Ben has this list. We have frontline employees, caseworkers, maybe both agents. Okay, I know what that's about. Ombuds, case managers being different, both private and government. Although I think that then maybe becomes Committee on Style. Is there anything else anybody wants to add to this before the Committee on Style smooths out this list? Oh, Steph, hello. Thank you.
Hi, yeah, for A on client surveys and targeted outreach communities, and I think Elizabeth might have been getting at this earlier, but I guess I'm wondering if the client and the community are distinct enough populations that those should be different. And then for clients, I wonder if we really just mean client surveys or if we mean a variety of outreach techniques. So would refer both of those questions to the Committee on Style.
Those don't sound like Committee on Style questions to me, though. Those sound like substantive questions about what the data show from the report and what we as a committee actually mean to be referring to, I think. So can you just say them one more time? Client surveys, do you mean to be distinguishing between client and community?
Yeah, I'm wondering if client surveys and targeted outreach to communities belong in the same, or if targeted outreach to communities is its own sort of standalone category.
Where did targeted outreach to communities come from? Was that something that we were picking up from before? Conway, was this part of the one that you were sent to talk us through?
Yes, Claire, yes. Claire
Great,
agreed to add that. I do think it's an important point that we would like mentioned, but I understand that it's a separate point than client surveys. So I think that could potentially be its own line. But similar to the discussion above, like in the context of Social Security, reaching out specifically to groups with specific disabilities as an example of like a targeted outreach that we want to see.
So, but are we not now conveying targeted outreach already with the language that we just worked on in the first part of recommendation 5? Ben, could you scroll us down a little bit so we can see? No, sorry, scroll us back up so that we can see the first part that we already worked on. Agencies should institutionalize procedures for consulting with individuals who interact with government programs, particularly those who face special barriers, to better understand the burdens in those programs. Is targeted outreach, Conway, is what you and Claire were trying to get at with targeted outreach already conveyed in number 5, and now we're just giving specific ways of doing that? Or do you want to be conveying something different? I think this was Steph's question. Are you trying to be conveying something different than client surveys?
I think maybe focus groups, like there are other types than just client surveys, other types of qualitative feedback
Okay, so client surveys and
Groups.
community focus groups or something like that? I mean, do you mean targeted outreach to be, like, is focus groups good enough, or do you want something else?
Yeah, I would defer maybe to Pam and Dawn on that as well. I'm not sure.
Okay, Pam and Don, what are your thoughts about this, whether we need targeted outreach in this list, if it's already sort of included in what we just worked on for the first part of 5? And if we do need something else beyond client surveys, whether we want, because client surveys, I see what Conway's getting at. It's sort of like you send out the survey in the mail or on your Google form or whatever, which is different from focus groups.
Yeah, I mean, I do think, I mean, I agree with, I mean, I think the idea is to get agencies to think broadly about a range of different ways that they should do this, that there isn't like one thing that you do to gather this information. And so I actually like, yeah, I mean, I sort of like the idea of adding like focus groups and the targeted, like, I actually like the idea of adding focus groups. Because I do think that was in part one thing we gathered from agencies is that like, this isn't, and partly we included this is because this isn't something that agencies systematically do. And in part, I think providing people with like a toolkit.
Okay.
Here's the way.
Well, then maybe more than targeted outreach to communities, maybe focus groups really is helpful because we're trying to spell out what that outreach could look like. So let's put it as client surveys and focus groups, where requests for public comment is a more traditional,
correct,
sort of put it out in the world means. Okay.
Right. Yeah.
So then, yeah, so then we'll delete that then. Okay. I'm not hearing tons of additions people want to make at this point. We have a list of things that will be for the Committee on Style. We have a list of some other aspects here that we're going to be including substantively. Steph, let me call on you.
I'm okay with client surveys and focus groups. I know that will lead folks to discuss the PRA at some point at the plenary session, which we should prepare ourselves for. But I did want to suggest maybe client outreach, and then in the preamble or in a parenthetical, we could say such as surveys and focus groups, because I think we're not necessarily trying to limit it. Just, you know, what we mean is outreach. It could be surveys, it could be focus groups, but
well, then let's say client outreach, such as surveys and focus groups.
Yeah, that's great.
Okay. Great. Okay, so it seems to me that we maybe can move on to 6, but I'm going to just pause here for a second to see if anybody else wants to weigh in on 5 before recognizing that we have substantive stuff to add and that the Committee on Style will smooth some of this stuff out. Substantive stuff that's already captured from this conversation. Okay, sounds great. Thank you. Let's go to 6. John, is this before we leave 5, or are you voicing a new thing on 6?
6.
Okay, great. So here we are. Let's open it up with your comment.
So this is a general comment, and I'm not sure how to resolve it, but 6, 7, and 8, the unit of analysis is the agency. And yet a lot of the burden is a cumulative thing when it's cross-agency. And so if you ask each agency to analyze their stuff, they're going to say, hey, my stuff isn't that big of a deal. But when you add 5 agencies together for a journey map or something like that, you suddenly find that there is burden, but no one agency sees it from their perspective. So what I don't know is, how do we capture this cross-agency cumulative burden in 6, 7, and 8?
So thanks for
right now, all we're doing is we're asking individual agencies to do something, not a consortium of agencies. So that's where I'm.
So I want to talk about that. I also want to note that it may be more helpful to talk through 6, 7, and 8 before we talk about that. But let me first just quickly ask Pam and Don. I know we have OMB recommendations towards the end. I can't remember right now whether one of those recommendations is a cumulative recommendation or whether a cumulative recommendation goes here. Because it may well be that the reason why we're feeling the absence here and the unit of analysis is the agency is because this just literally is the section of the recommendations where the unit of analysis is the agency. Pam and Don, do you happen to remember what we have? Maybe we should just scroll down quickly and look at it. Ben, can you
scroll down?
Burden reduction. agency organization, agency collaboration.
It's number 19.
Number 19.
Yeah.
Okay, so John, I think the way I would like, and I see you already have a substantive comment here on the cross-agency priority. I think for now, I would like to suggest that we defer this, dealing with this point on like the cumulative burden until we are in this section. But I'm
Okay.
also going to ask us to put a placeholder here so we make sure that we come back to it and record this point. So Ben, can you maybe just at the, in line 93 or at the header or for agency collaboration or something, just have us have a placeholder for discuss cumulative burden across agencies. And then that will remind us that we need to reopen John's comment when we get here. But thanks for flagging it now.
Sure.
Okay, let's go back up to the top now, where admittedly we're all working in the agency as the unit of analysis for 6, 7, and 8. And let's go to 6. To help identify burdens, agencies should use the information obtained through such consultation to map the journeys of individuals who engage with their programs so that agency personnel can identify the procedures individuals face and resulting burdens at each step in the process. I think we had a comment, though I don't see it, obviously, it might be in a bubble beneath, about needing to define what map the journeys means. I don't remember whose comment that was. Ben, is there a way to find that? Or if you're here and it was your comment, do you want to raise your hand? And if you are not here, Pam and Dan,
Eloise, I'm not positive, but I think that might have been a comment that we had internally between you, consultants, and some other staff members. And then we resolved it by adding.
Sure, I'm willing to believe that. What does it mean to map the journeys? How do we feel about that as a term of art? Pam and Don, do you want to, how should we handle this? Because map the journeys they're all words that mean something, but they're also a term of art and they're not completely defined here. And so I wonder if there is something that we want to do to call this out or to explain what we mean. Or maybe we just want to have defined map the journeys up in the preamble. I'm not sure what people's reactions are to that.
So I think journey mapping is defined somewhere in the report itself. I think we have like a box of terms like human-centered design and journey mapping. And so that, it does capture a specific term of ours. OMB uses journey mapping experiences to reflect that. And so I think partly the language is intended to be consistent with that. And the idea is that one of the ways to capture people's experiences is to break down every step in their interactions with government and sort of figure out where people get in trouble or struggle with those steps, rather than just rely on customer experience evaluations that you might get at the end of the process for the people who succeeded in completing it.
Okay, so are people, that's helpful, so thank you for that. Are people comfortable if we define map the journey with the citation to both the report perhaps and the executive order and the preamble, if we just leave it like this? Okay, and then are there any, Pam, did you want to say anything?
Yeah, okay. You're very good. See, me just open my mouth and you knew to. So yeah, I mean, I think that's a good idea. And maybe I'm just making this more complicated than it needs to be. But I think the bigger picture point is really the last thing Don said, which is that agencies tend to evaluate processes at the end. So they're only talking to the people who made it through the process successfully, and they're missing out all the people who didn't make it through the process. And so that's the value of journey mapping. So if there isn't some way to kind of express that in the point, basically. But if I'm just making this too complicated, that's fine too. But I did really want to reiterate, like, the bigger picture. That's why this is valuable, basically.
So I think that's captured in line 30 at each step in the process. Right, it sort of is conveying that, but I'm open to hearing other thoughts if we want to make that stronger. David.
Yeah, I just want to make sure that you also consider the small agencies who have clients who access information in very limited ways, and but who still can put burdens in front of people. And I really like this report because it reminds me that even though I don't give out benefits, I do have people that try to access my information, and I need to reduce the burdens. That said, this requirement or suggestion or the statement that I should use journey mapping, I should do all these things, really seems like putting a fairly large administrative burden on agencies where the benefit of doing all this work would not be met. So now I'm getting back to what I thought this report was actually about. So I'm
So do
sticking
you,
up the
are
roads
you,
administrative burdens. Yeah.
is the suggestion embedded in your point to use a different word than should?
Yeah, may or might find it useful, or often
Consider.
should.
Yeah, we
Yeah.
often have a debate in ACUS about should versus should consider.
Yeah.
And often it's like a small agency comment from small agency about burden on small agencies. So I welcome more comments on this verb point. Steph?
I think journey mapping is important, but I agree that it may not be appropriate in every situation. And so I just wonder if maybe the consultants have some insights on where it might be particularly important, such as with, large benefit programs or benefit programs where there's inadequate take-up given a statutory authorization, or, if there's a way to target this to say, hey, you should really do this, where you have individuals who are engaging but not ultimately participating in the program.
Pam?
So this is Don. So the executive order, I think, distinguishes between high impact agencies that have frequent interaction with the public and others. And that is a recognition that like these recommendations are maybe not going to work as well for every agency. So I don't know if maybe that is a clarification that we could put in the preamble, which is to say, like, it feels like there's two ways of doing this. One is to say these recommendations are generally going to be most appropriate for agencies that interact a great deal with the public, and stick that in the preamble, or you could just caveat the words with like may or should consider in the actual recommendation. So there are trade-offs between trying not to be incredibly one size fits all in a way that is overburdening small agencies or agencies that don't really interact much with the public, versus not making language so amorphous that you're not really recommending anything.
David, is your hand back up to respond to that, or no? Your hand is up.
It is raised.
Hold on.
Yes, that makes sense to me. I'd be, and I think you can do it either way, but making it clear that many of these recommendations will not be as useful or as necessary in smaller agencies, would give us small agencies the ability to read this report and say, okay, we're not going to do that, but we're going to do this.
So that does sound like some preamble language. So let's make sure that we get that in the preamble then. I wonder if the key point in number 6 is really journey mapping, or if it's to make sure that you are evaluating you're finding burdens at each step of the process, and journey mapping can be a helpful way to do that. I am not sure if the substance of David's concern was that journey mapping itself sounds hard and maybe trade-offs for his agency won't be worth it, but it seems reasonable and intuitively correct to think that there may be burdens at the end, but you also might want to think about burdens at the middle and at the beginning. Journey mapping could be one way of doing that. Is that another way of handling this, that we've kind of raised the level of generality of what number 6 is about with journey mapping as an example, or not? Steph from OMB just said journey mapping is both important and a term of art. So Pam, what are your thoughts?
Yeah, I'm really open to making it more general. I think the broader point is what's integral, which is like you're looking at multiple stages, and this is just language that, you know, it's like a short and dirty term for describing that broader point, which is twofold, which is like being sure that you're evaluating every part of the process and you're not only considering the opinions of the 40% of people got through your process, you're thinking about the other 60% who didn't, right? And so by doing this step-by-step evaluation of the process that people go through, you're more likely to ensure that you're capturing the problems with the process that you can see both by talking to people who get through it, but also the people who you haven't been able to talk with about that process.
So I actually wonder then if that's the point, then mapping the journeys starts to seem way too specific to me. So what if we want to just delete a lot of line 28 and just have it be to help identify burdens, agencies should use the information obtained through such consultation to identify the procedures individuals face and resulting burdens at each step. No, sorry, Ben, I'm not suggesting adding language. I was suggesting deleting. So to, and then cross out, yeah, that through can. So cross out a few more, yeah. Would that capture it? And then mapping the journey is one way to do that? Because otherwise I'm a little afraid that the focus is on mapping the journey, and that gets to David's point about that being really, really too specific. Or is mapping the journey, you know, that's not a term of art that I work with, so I don't really know. Is that important enough that you need to have that front and center?
I'm just sorry, I'm slow. It takes me a minute to read the language. I think this is okay. I mean, I might like something at every stage or something just to emphasize. Oh, each step of the process.
Yeah.
Yeah. I'm okay with that. Don, does that make sense to you?
Yeah.
Okay, and David, does that capture some of what you were getting at? Okay, does anybody else have any comment or concern or question to raise about either this or anything else of recommendation 6? Okay, should we tackle recommendation 7? Agencies should trace the legal or operational source of identified burdens in order to determine whether they are imposed by statute or by regulation, guidance, or agency practice. Thoughts? Steph?
This is maybe more of a general comment and not particularly helpful in considering this recommendation, but I do want to note that, you know, oftentimes administrative burden is imposed at the state level and not necessarily at the federal level, particularly for programs that have a federalism aspect, or, you know, where the states are doing the actual implementing. And that same comment is true for administrative data sharing as well. Like the administrative data may not always be available to the federal agency. So I think it might be helpful in the preamble just to be clear that about whether we're asking agencies to also examine burden that is external to the agency, or whether we're focused on burden that is within the agency's own control, or at least Congress's control, where they can provide, you know, feedback.
So thanks for that. And there is a whole section on federalism in the report. So yeah, that's especially helpful to have a marker for that. So let me just first throw in some language that might accompany what Steph has just said and put it up for discussion, because there's also the substantive question of, are we asking agencies to do it? But so the language could be, so the existing language is, should trace the legal or operational source of identified burdens in order to determine whether they are imposed by, and then we could add federal statute, comma, state law, comma, or by. And so it's really just clarifying federal and then state law without calling out different sources of state law. And I guess that might capture both the point in the report that a lot of the time the burden is not actually a creature of the agencies. It's because they're implemented in 53 different jurisdictions, but also captures, I think this might get to your point, Steph, that we're not necessarily asking agencies to do anything about the state law burden as much as to figure out what is within their control to do, and to figure out what is within their control to do actually might require them to separate out where individuals are facing a burden because it's imposed by Congress, or because, you know, it's imposed by some state implementation of the program. So that's, I guess, a soft suggestion that maybe this captures the last couple of minutes of conversation, but I would love to hear some comments from the floor. John?
Are we referring to state regulation, state guidance, and state agency practice as well?
I was suggesting that
state law?
law was loose enough to capture all of that, right?
Okay.
But that may be my,
Yeah.
I don't want to me, it seems super complicated because we don't actually care from the perspective of, is it within the agency's jurisdiction to fix this? It kind of doesn't matter whether it comes from the whatever state legislature or the whatever state Department of Education or whatever.
Yeah.
What matters is it within the agency's control to do? And if the state program, however that's designed, you know, so I don't think the source of law matters so much at the state level for the purposes of what we're asking them to do.
Yeah, because if you're looking at it from the individual recipient's perspective, they don't care whether it's federal or state. And at the federal law, I mean, if nothing else, it's putting a spotlight on state practices that are creating burdens, and that state A may rank #1 in burden imposition, and state B may be number 50 at burden. So just having the federal government, even if they don't have control, merely highlight what's going on may help change practices.
Okay, thanks for that. David?
I was just going to suggest that we could keep the original language of imposed by statute or by regulation, guidance, or agency practice, and then just add at the federal or state level. That would allow.
And why do we want that? What is the goal of that language?
The goal then would help us identify whether the administrative burden is coming from federal law, federal regulation, federal guidance or practice, or state law, state regulation, state agency practice. So if we're really concerned about sort of user-centered design, then, and we care about where the burdens are being imposed, then that would cover the whole gamut of state and federal action that imposes administrative burden.
So I am going to out myself here as the person who initially added recommendation 7 in the draft to begin with. And so I guess I'll say that my goal in adding this was to figure out what's within the agency's own control, as opposed to not their control. And not their control is what Congress tells them to do, and not their control is what the state tells them to do, whatever the source of it. I get a tiny bit worried. I will say maybe I'm taking off my committee chair hat here and putting on my former just general member of this committee hat. I don't know if this is inappropriate. ACUS people in charge, stop me if this is inappropriate. But I get a tiny bit worried when I think about making agencies sort through in a 50-state program, whether a source of requirement comes from the legislature, the Department of X, the Department of Y, who have joint program oversight. That seems kind of super burdensome on the agency to me. Whereas what I was going for in adding this was just like, we can't tell agencies to reduce burden if half of the burden is not even within theirs to reduce. So that was sort of what I was going for. But I take your points, and I guess I just wonder what you have to say in response to that concern. Gosh, and now I'm going to put my agency, I am chair of this committee hat back on and take off but I write about grant management and it's so complicated in the States. Okay, I'm done.
Yeah, no, I hear that. And so both things can be true, right? Which is that so many government programs, federal programs, are administered at the state level. And so many states are the ones that are imposing administrative burden with federal programs, making it hard to do things like get the GI Bill if you're in Mississippi, or, getting access to, different programs. And so if the real source of administrative burden is federal programs being tacked on, like problems being tacked on at the state level, it seems like agencies should be focused on where that administrative burden is coming, and in the design of their grant programs or their regulations, trying to sort of make those processes simpler. And I completely grant your point. So I don't think it's easy, but I do think that, given how big a role the states have in implementing federal programs, it's important to know.
Okay. As committee chair, I hear that gratefully. Thank you, David. John. Oh, I think you're on mute.
In reinforcing what David said, I mean, that's you know, the world of performance management is we focus on results, not on activity. And if you don't control the results, I mean, like when the Department of Justice created its first mission statement that didn't say anything about reducing crime, and that's because they said, well, we don't control crime. It says, yes, but isn't that part of your mission? So part of the mission here is, if the focus is reducing administrative burden, looking at it from a human-centered design, it doesn't matter where the burden is coming from, define it, and later figure out how do you design the program so that you have impact. But
Okay. And so the point is that this is just front-end evaluation. That makes perfect sense to me. I would love to hear from some agency folks. I was sort of channeling agency concern in my substantive comment, and I don't know if that was overstepping because I am, in fact, in my professorial office here. So would anybody like to comment on this? I'm perfectly happy to go with what David and John have said. But before we write that out, or we could maybe write it out to see if people from agencies want to comment. So it would be whether they are imposed by statute or regulation.
I can read you the language.
Sure.
So it would just keep the imposed by statute or by regulation, guidance, or agency practice at the federal or state level. So just tax on at the federal or state level at the end and removes federal before the statute and removes state law.
Great. Okay, anybody want to comment on this? Especially anybody from an agency, but also anybody. Pam?
So this is actually.
Oh, Don?
Sorry.
We're sharing microphones to avoid feedback.
That's okay. It is a tiny bit hard to hear you, though. I wonder if you could come a little closer.
So I really like the recommendation, and because I interpret the purpose of the recommendation to be that agencies should not have the excuse that, well, we've always done it this way as a rationale not to fix problems, or there's some murky reason that we think is tied to law, which is not actually tied to law. And so maybe there will be like a half sentence that could be included in there that sort of states the reason why agencies should make this distinction between tasks that are under their control and tasks where they can change things. Because, I think the purpose is to get agencies to say, oh, we can actually fix this problem. It isn't set in stone. We have some control here.
Okay, so do you want to propose language, or do you want me to propose language that captures that?
I would defer to you.
Okay. How about at the beginning of that sentence, something like to determine what is within agency's own control, or to identify the burdens that are within agency's own construction, or something like that. Let's put a placeholder for that right now, and I'll call on David.
Yeah, I have no objection to that. That's exactly how I read the sentence in the first place.
Okay,
which is, I thought that seemed like clear that was the purpose of the sentence, but
great.
There's no problem putting that on there.
So, and then I think maybe more than that could be committee of style. It sounds like there's general agreement on the concept. So determine which burdens are within the agency's control, or something like that. David?
Yeah, I was just going to say, I agree with the other David that I sort of read the sentence in its existing form to do what Dawn was suggesting, which is, and so I don't know if we need that additional text beforehand, but I'm happy to leave that on committee on style too.
Okay, great. Okay, anything else on 7 before we move to 8? Okay, let's move to 8. So 8 says agencies should measure administrative burdens associated with their programs by estimating and quantifying to the extent feasible the learning, compliance, and psychological costs of their programs, for example, by converting time to financial costs by using the average value of wages as estimated by the Bureau of Labor Statistics. So I think I have a comment in the chat from Warren, who I'll recognize in a minute, but I also, John Kamensky, are some of these comments on the side? No, the cumulative one we've deleted. Yes, compliance. So let's start with your pre-submitted comments on compliance and or, and maybe you can explain that to us.
The only comment I have is it cumulative, learning, compliance, and psychological costs, or is it any one of the three or any combination? I know that that ACUS does not like and or, but I don't know any other. But
so is that a substantive question to the consultants, what they're going for?
yeah, I don't think it needs to meet all three of those standards.
Right, so it could be quantifying to the extent feasible any learning, compliance, or psychological costs. That would capture that.
Yeah.
Okay, so let's do that. I saw 2 nods, I think. So David, are you coming in on this exact language? Because if you are, I'll call on you and then, okay, David. Oh, but you're on mute.
Well, ironically, I was saying you already know what I'm going to say, which is, okay, you've just created a little paperwork reduction act here, and consider the cost of trying to measure the cost of something that is pretty insubstantial to begin with, and perhaps the answer to comment number 6 is the answer to this one as well. That this is something that one does not need to measure to know that you're being a pain in the patooey, and that you can fix that.
Let me call on Warren, who I gather wants to be recognized on a similar point, and then Steph, I'll call on you. Warren?
Thank you. My thought was to delete 8 entirely. And the reason is it puts an unbelievably large burden on all agencies, regardless of their budget. And I think going forward, we're going to see budgets cut at these agencies. And while it's a nice thing to do, I'm not quite sure you want to convert it into dollars or talk about measuring psychological costs. The agencies have lots more important things to do, I think, than to try to do this. And it's not necessary. I'm not quite sure what the benefit is when you get there, because what you're really saying is we've identified a burden already in the earlier provisions, and we're trying to figure out how to address them. And this is just another way of trying to, I think it just creates more work and more expense and more hiring and more activity in agencies that will not have the budget to do it, let alone the more primary important things that we're asking them to do.
Okay, thanks for that, Warren. Steph, and then Pam.
I like this recommendation in principle. I do think, we do already ask agencies to do this to some extent, including by under the Paperwork Reduction Act and using that particular methodology in the parenthetical. I think that the parenthetical is too specific. I would definitely seek to strike it or move it to the preamble. I mean, that's the way that we quantify burden under the PRA, but to me, this is something agencies are already being asked to do to some extent. I think it's something that they should do. So, I'm preaching to the choir over here. It feels like, yeah, this is definitely important. I wanted to raise a slightly different point, which is I'm not sure quite what it means to say the psychological cost of their programs. That was a little bit nebulous to me. I'm not sure.
I think interacting with is what is our missing words.
Okay,
yeah, that capture. Okay, so I want to figure out if you have anything else to say, but first let's just capture what you have said. So of interacting with, let's add that in line 37, Ben.
And then I would strike the
and let's strike the parenthetical.
Yeah, sorry.
And we also have on the table striking all of 8. And I think we have a couple of votes for that so far.
Yeah.
So
and then I had one final point to make, which is just
Sure.
that I think the other side of the coin here is the foregone benefits and services. And so not only is there the administrative burden, which under the PRA agencies are supposed to be looking at and examining, but there's also the value of the foregone participation in the government program. And so I feel like that's sort of cutting edge, it's something that we're considering as we think about the new frontiers of cost benefit analysis, but I wasn't sure if that was something that would be appropriate to include.
Yeah, so just to make sure I understand, so you're suggesting to the extent that we keep the first 3 lines of recommendation 8, you're suggesting almost an and, notwithstanding the concern about the burden on the agency, you're suggesting an and that
foregone benefits and services and
caused by the burdens, right? The foregone.
The administrative burdens associated with the programs by estimating, quantifying the cost of interacting with their programs and the foregone benefits and services.
Okay, can you capture that, Ben?
Because I think this can be, in some respects, a more meaningful number than the amount of time that an individual spends filling out a form. It's like, what is the loss of the benefit to?
Yeah. Okay. Okay, thank you for that, Steph. Pam?
Yeah, I'd really back up what Steph just suggested about the foregone benefits. But just a reminder, big picture, yeah, like as she was saying, like, I think this was embedded in the report because the PRA does require that agencies do this already. And the Biden administration, like they've issued guidance about how to do it better. Like the agencies actually weren't doing this right to begin with. And they've issued guidance about how to better fully capture basically these costs. I mean, the costs are, so the costs are important from the cost benefit analysis part of it. So when an agency thinks about adding a new procedure, a new requirement or whatever, the degree to which they're really thinking through all of these costs before they issue that new requirement or form or like all that sort of thing. That's the spirit of it. But I see the point, like they are already supposed to be doing this. So is it redundant to have it in here? Whereas this foregone benefit point is actually not. Like that's not happening, and that would be amazingly valuable for the same reason.
Okay, so then one possible way of translating that plus Steph's last point is we could actually delete the first part of 8 and have this recommendation simply focus on evaluating the foregone benefits of services. So I don't know if that, I'm not suggesting that necessarily, but I'm wondering if that captures what you are getting at. Would it or it wouldn't?
I think the problem is that even though agencies are supposed to be doing this, they're not really always doing it. Even the basic part. So I'm a little bit hesitant to pull it out just for that reason. Like there's lots of
so it feels belts and suspenders. You like the suspenders here.
I like that expression. Yeah.
Yes. Okay. All right. I use that all the time in class and I feel but it turns out that students don't actually know what suspenders are. So it turns out not to be a useful phrase. So I'm glad you like it. You were the only person I have recently said it to who has liked it. David.
Yeah. First of all, the second half is clearly more important than the first half, which is the foregone conclusion. I have to say, I just have no idea how you would measure that. It's all good and well to say to do it, but how? But if you could, that'd be great. Just an anecdote. I mean, yeah, we're supposed to be doing this, but interestingly, the first time I filled out my Paperwork Reduction Act form, the form also asked me to estimate how much agency resources were spent complying with the Paperwork Reduction Act. And every time I've done it, the agency resources spent in a small agency to comply with the Paperwork Reduction Act far exceeded the total amount of cost to the public of filling out the form. So, but at any rate, I just think we have to, before keeping piling on these things, we need to consider the cost.
Yeah. Warren, you have been waiting patiently with a request in the chat to be recognized.
My question was, are we talking about measuring individual costs or cumulative costs? If it's individual, we've now identified different individuals have different challenges, which create different costs. We've got so many different things, whether it's psychological or learning or reading or what have you, and then trying to come up with each group's individual cost or the total cost of a program, which may be very good, but that's just the way it would be. So again, I just don't see this section recommendation 8 is really helping the whole recommendation and putting a burden that I don't think the agencies will be able to handle on them at a time when they've got bigger fish to fry.
Okay, I am not totally sure how to resolve these multiple conflicting pieces of input. Pam.
Just on the like, how do you do it part, there is specific guidance from OIRA about how you do this. So one version, I mean, like ultimately it's up to this committee to decide whether or not they want this or not. But if the question is like, it's not clear how to do it, you could cite the OIRA guidance about how to do this. Like that would be one option.
And I think there are, examples of ways to do this that are not intrusive. Like you can just run surveys of agency clients with very short user surveys of 3 or 4 items where you just measure this and you say this is the reported burden that clients have experienced. And this is, something that private organizations do all the time and governments do not do terribly much. So, I think there is some value to identifying this as a practice that isn't done in government and certainly will require some resources, but there is an argument for doing this because it does sort of shine the spotlight on a domain that traditionally hasn't gotten a lot of attention.
So I'm not sure where the sense of the committee is as between deleting the parenthetical, deleting the whole thing. Like, I think right now I've heard only one suggestion. I don't think, David, that you were also suggesting cutting all of 8. In fact, it seemed to me that you were nodding with the addition of the foregone benefits. But on the other hand, you also made this comment about the overall burden of the PRA in general. So I'm just not sure. We have to reach consensus in some way or take a vote and move on. And I'm not sure where the sense of the Zoom room is at the moment on what we do with 8, given the various proposals we have on the table. So David,
I think it's great to try to understand how many people aren't getting the benefit, how many people are not voting because of voter registration, all those kind of things is great. And if there's a way to do that, then I like having the focus on that. Requiring agencies to measure and analyze all the burdens on filling out paperwork. Like you said, we've already got the Paperwork Reduction Act. We don't have to repeat it here. And to the extent that we're adding a burden, that I certainly don't want to do it on the agency. But measuring how many people are denied a benefit, to the extent that can be done, of course, that is really valuable information to have.
Okay, Steph.
I mean, one of the strategies that the conference often uses when dealing with agency resources concerns is to include a qualifier, like to the extent feasible. And we have that qualifier here. So I wonder if that helps to alleviate the concern or if it could be made more prominent or tweaked in some way if there is a resource concern. And I did like the suggestion earlier of like in the preamble addressing scale and, where there's more administrative burden, you should more often. And so, ideas.
Okay, so then we may have mild consensus with like a 1 or 2 dissenting voices. Warren, I know this doesn't address your concern, but if we leave it as it currently is without the parenthetical, can we kind of reach general consensus? Can people live with that? Given the wiggle language of to the extent feasible that Steph has pointed out is there, and given the new focus on the foregone benefits?
I'm sorry, are you asking me?
Well, I mean, you're welcome to respond. I'm asking the room as a whole. I have a feeling that you still don't like it because you want it to be gone. So I guess it is sort of a question of, can you live with this? And then where's everybody else in the room on this?
I'll live with whatever the committee comes up with, but I just don't know how you can measure it individually or cumulatively to have any real benefit from going through the process.
And so this is then where a citation to what Pam and Don were suggesting before, or staff was suggesting before, might be helpful. Okay, I don't hear lots of objections to this, so I think I'm going to suggest that we move on with the language that we have here. So let us begin at 3:46. We're going to begin. The consultants were not totally sure that we wouldn't get through everything. And I said, there's no way we're going to get through 27 recommendations in 3 hours. So, so can we just, Ben, can you just show us quickly what we're looking at in total when we think about burden reduction strategies? So we have 9, which is about reviewing to identify ways to simplify. We have 10, which is thinking about online and alternatives. 11, reducing steps. 12, making information easier to see. 13 is language accessibility. 14 is providing help for interacting. 15 is let's figure out what's not within our control and give it to OMB. Okay, so that's like the overall scope of where we are. Sometimes it's helpful to have a sense of other stuff as we begin the first one. So let's start to see how much we can get through. Maybe we can get through number 9 before we call it to a close today. So agencies should maybe periodically review their administrative processes to identify ways to simplify them. Opportunities for simplification may include, and then we have 4 possibilities here. So John, let me call on you because I think you were the addition in green of periodically.
I think that there was a comment somewhere else of, is this a one-time thing or is this an ongoing thing? So I wanted to reinforce that this is not something that is just a one-time review, but they should periodically review. So that's all.
Okay, great. Thank you. And then Conway, did I see your hand briefly go up? Are you explaining the stuff in blue or
Yes.
perhaps red from Claire?
Right, yes. I would say that actually, I would suggest that the Claire's edit on 9A be moved to 11, which goes into ways to limit the number of steps. So I think data sharing could actually be better suited in that recommendation around pre-population. So I wanted to flag that.
So can you just cut and paste that, Ben? The stuff in blue that's currently right there, just cut and paste it, move it below, and we'll address it when we get to number 11.
And then while I'm on, I just said that Claire's comments about the wet.
Yeah, although hold on for just one sec so that we can just paste without, because he's got to listen to you too. Okay, go ahead.
And I think we had the discussion around recommendation 7 about the legal sources. I think that addresses Claire's other comment about wet signatures. I think it's more of a comment rather than a suggestion. So I just wanted to mark that it doesn't need to be an actual change.
Okay, great. We're not quite there yet, but let's.
Understood.
We can get it when we get it, and maybe, I don't know, will we get it today? Question mark. Given the edits currently on the screen, does anybody have any concern about 9? Are we good with these tweaks?
I think that I wanted to talk a little bit about 9C.
Sure, go ahead.
And this.
Oh, right.
Every documentation requirement is inserted because somebody thinks it's necessary. So limiting unnecessary means that somebody thinks, you think my necessary document is unnecessary. So unnecessary begins to clutter the thing. But and I agree, but I just think that putting that in there encourages people to say, oh, then I'm off the hook because all my documentation requirements are necessary. But the other thing that I wanted to highlight here, and I don't know whether it's adding an E or something, but the use of common standards or documentation. I know that it took months for HHS, VA, and HUD to agree on what chronic homelessness was, and so they couldn't jointly deliver services because they each had their own definition, and so that they each sort of couldn't work together. So this notion somewhere in this list of opportunities for simplification may include common documentation or common, what are required for income verification may vary between agencies, even if it's the same document. They pull
So
off different things.
would
So
something like adopting shared definitions work, or you're talking about documentation as opposed to?
I think it's both. It's shared definitions, but also shared documents, so that you don't have the need to reach for different kinds of documents that cover the same issue.
Yeah. So this is the same kind of comment that you made at the beginning of burden identification strategies. And I am wondering if we will need to put it down with the cross-agency kinds of things that we have below.
Yeah.
Can you, Ben, can you just scroll down to where we flagged John's other point that was kind of in this vein? Yeah, maybe it's up. It's on the collaboration.
19. Yeah.
Yeah, collaboration.
Yeah.
So can you just kind of add there? John, are you okay? Because I think it may be worthwhile discussing all of the collaboration points together.
Okay.
So maybe we'll do that. Maybe we'll do that.
That's fine.
Okay, so Ben, can you just add that? Shared definitions and documentation requirements?
Yeah, there we go.
Let's go back up to 9. On your necessary points, I don't know that this would capture it, but if we deleted unnecessary, I'm not sure who put unnecessary in. And then, because that looks like it's an addition, but what if we take out unnecessary and put where possible? Limiting documentation requirements where possible?
I think that's better than calling it unnecessary, because agencies will define everything they do as necessary.
Exactly. And that sort of gets to the difference between legal requirement and just because we've always done it. Okay, with that, is there any other concern anybody has that they want to raise about 9? Okay, I'm going to ambitiously try to get us through 10. Let's see if we can do it. We have 7 minutes. Who knows? Agencies should allow the public to interact with government programs using online processes while still retaining in-person processes where necessary. And then this is where that alternative for wet signature requirements came in. So Conway, tell us what you wanted to say about wet signatures here.
Yes, Claire has a comment about how the requirements for signatures, be it a wet signature, digital signature on behalf of, can be inconsistent. And so I think this goes to the broader point about identifying where the burden originates from. Is this in statute? Is this for in adherence to like a security standard? I think the broader point is that it's inconsistent. So I don't know what line edit would kind of accompany this. So I just kind of wanted to raise the issue, but I'm not sure.
I mean, but what could happen is up at the right before we go into A, B, and C, it could say in particular, comma, agencies should, comma, where possible, or something like that, because then that would capture.
Yeah, I think that would help.
No, Ben, that's not where I meant where possible. Sorry, it's the next one, right before the colon. Because I think that first sentence is always going to be possible. So it's really this next one where there might be varying legal requirements depending on the different statutory scheme. Okay. And was the telephonic signatures, that was Bernard's point. That's not, and he's not here. So let's just see what his comment is.
I'm actually back, but.
Oh, Bernard, I'd love to call on you. Although first I see that Pam has to hop off. So goodbye, Pam. But Don, I think you're still here for the last 5 minutes. Pam, thank you so much for working with us on this. So we're going to try to finish 10 if we can in the next 5 minutes. So Bernard, welcome back. I hope you had a great class. Talk us through telephonic signatures.
Oh, you're coming to me for that?
Well, I don't know. Did you, it was your point.
No,
right?
I just had a question about
yeah.
What are they? And I don't need to hold up the meeting.
Okay. No, I don't think it's holding up the meeting, but you want to have that defined. Don, is that defined in the report? And can it be defined in the preamble?
I do not recall if that is defined in the report. I maybe a level of detail that's more specific than we want for the preamble, but I'm happy to defer to the style committee on that. I
Well,
think we
it could
can
also be, we could just delete this such as, unless it actually adds something. Because isn't the point that just we want alternatives for wet signatures? And then maybe those alternatives don't have to be spelled out. Or do they? I don't have a sense. Don, do you think it's important to spell them out?
I don't have a strong preference about in the recommendations, as long as they're somewhere in the main report. I think that would make sense.
Okay.
Yeah, I'm not really asking that it be taken out. I just, at some point, would like an explanation, because the part in the report was not quite clear on what it was. So if
Okay.
time,
So
if
let's flag that.
fine.
Let's actually flag that for drafters of the preamble, because it's possible that we can either, the report is also a draft report, so we can presumably either add like a more clear definition with the citation there and then add a citation in the preamble to the report, or we can add something that's definitional in the preamble. So thanks for flagging that, Ben. Steph?
On B, and I'm going to show my lack of technical expertise here, but I was hoping that instead of specifying login.gov, including to leave flexibility for future iterations, that we could just say allow individuals to use universal login. And then I wondered, and we could discuss login.gov in the preamble, or it's also discussed in the report, but folks may be aware it's not without controversy for a variety of reasons. So I think just universal login is broad enough to capture login.gov or other types of logins that agencies might
And I think
use.
that's right, because I think in ACUS, we do try to be non-specific about a particular source of technology that might change.
And then I wondered, so if the used by government agencies is important here, or doing any work, I would just strike it, probably allow individuals to use universal logins,
Is there something that do we need to capture government? Do we have to have the word government though?
Government universal logins would be okay.
Yeah, okay. Allow individuals to use universal, to use governments.
To use government universal logins or
universal logins available to the government.
This is going to get us into like the ID me sort of
okay
sphere. And so I defer to the consultants if they
let's see what the Committee on Style can do with that. Ben, can you put a note to just have some government connection there? And last comment from John, and then I'll close us.
The comment that I have on this is it allowing the individual or encouraging agencies to adopt? I mean, which direction are we talking about?
I think we are, but it's agencies should. Steph, are you commenting on this?
Yeah, I am. So, the other point I wanted to make is just that, in general, I think people ought to be able to opt out of this if they would like to. And so agencies should allow it. They should permit it, but that doesn't necessarily mean that they should require it in all circumstances. And so I'd like the formulation where it says agency should allow individuals, or, you might formulate it as provide an option to, but I do think it should not necessarily be required.
That's great. Thank you. Okay, it is 3:59, and I am going to say that the Committee on Style is going to try to capture and smooth out this provision 10, and we'll look at it when we come back next time. I want to thank everybody for intense and good work over the course of today. Our next meeting is on October 30th, which is a Monday at 1 p.m. And so we'll hope to get through the rest of the recommendations then. I am going to say that I think it may be that we need our third meeting. So I don't have the date of that on the top of my head, but I know that it's been reserved in your calendar per previous ACUS conversations. Thank you to the consultants for doing such a great job. And thank you to all of you for all your excellent, excellent work today. And I look forward to seeing you in a couple of weeks. Bye.
Thanks, everyone. Take care.